What if the person everyone in the room ignored was the only one who could see that a little girl was running out of time? What if one tiny detail hidden behind her ear could mean the difference between a normal hospital visit and a life-threatening emergency? The pediatric imaging room was already crowded when 26-year-old Emma Carter walked in with her tablet pressed against her chest. She had been a nurse for only 4 months. 4 months was long enough to understand how a hospital worked, but not long enough to earn much respect from people who had spent years wearing white coats. Emma knew that. She also knew something else. A patient did not care how long a nurse had worked. A 5-year-old child did not care about titles, degrees, awards, or years of experience. A child only cared about whether somebody noticed that something was wrong. And right now, something was very wrong. 5-year-old Sophie Bennett was sitting on the examination table with her knees pulled close to her chest. Her pink shirt was damp around the collar from sweat. Her cheeks were bright red from fever. And one tiny hand was pressed tightly against the area behind her right ear. Her grandfather stood beside the table. He was a decorated Navy Vice Admiral named Thomas Hale. For more than 3 decades, Thomas had commanded ships, led thousands of sailors, and stood in rooms where decisions could change the lives of entire crews. But none of those experiences had prepared him for watching his granddaughter suffer. He could order a ship to change course. He could send aircraft into the sky. He could make decisions under pressure without showing fear. But he could not make his 5-year-old granddaughter stop hurting. That was why he had brought her to the hospital. And that was why he was beginning to lose faith in the doctors. Because this was not the first time Sophie had been treated for the same problem. It was the 8th. 8 different visits. 8 times she had been told it was an ear infection. 8 times her family had followed the instructions. And 8 times Sophie had gotten worse. Emma looked at the chart. A fever of 103.4 degrees. Repeated vomiting. Headache. Extreme tiredness. Pain behind the right ear. Something about the combination made her slow down. She had seen the same kind of pattern before. Not in a hospital. Not in a classroom. And certainly not in a nursing textbook. She had seen it years earlier while working in another world. A world she had never told anyone at this hospital about. But before she could examine Sophie, a senior physician walked into the room. Dr. Adrian Mercer was confident, experienced, and highly respected. He glanced at the chart. "It's another ear infection," he said. Emma looked at him. "Doctor, her temperature went up again, and she has been vomiting. Children get fevers. She's also unusually sleepy. Children sleep." Emma lowered her eyes to the tablet. She knew better than to argue without evidence. But something still bothered her. The pain was not simply inside Sophie's ear. The child kept pointing behind it. Emma looked at Sophie. "Sweetheart, can you show me exactly where it hurts?" Sophie slowly lifted her hand. She pointed to the bone directly behind her right ear. Emma felt a strange chill move through her. She crouched down until she was at the child's eye level. "Does it hurt more when you lie down?" Sophie nodded. "Yes." Emma looked at Thomas. "How long has she been complaining about headaches?" "Since yesterday," he said. "Anything unusual about her behavior?" Thomas hesitated. "She fell asleep during lunch." Dr. Mercer sighed. "Again, children sleep." But Emma did not look at him. She was watching Sophie. The little girl's eyes were half closed. Her breathing was slower than it should have been. Emma took the small pen-light clip to her pocket. She carefully checked Sophie's pupils. The left pupil reacted quickly. The right one reacted more slowly. Only slightly. Most people would never notice. Emma did. And suddenly the room felt much smaller. She remembered another patient. Another place. Another day. And another person who had looked at her while everyone else was still trying to understand what they were seeing. Before we go deeper into Emma's discovery, show this story some support by tapping like, subscribing to the channel, and sharing this video with someone who loves stories about unexpected heroes. Every little bit of support helps these stories reach more people. Emma looked behind Sophie's ear. At first she saw nothing unusual. Then she noticed it. A faint change in the skin. A subtle darkening near the bone. It was so small that another person could easily mistake it for ordinary discoloration. But Emma knew it was not ordinary. She had seen that kind of change before. She straightened. Dr. Mercer, I think we need to examine the area behind her ear again. I examined her 10 minutes ago. Not the ear canal. Mercer turned toward her. What? The bone behind the ear. His expression hardened. Emma, the diagnosis is otitis media. We've already documented it. Emma remained calm. I understand. Then why are we repeating the examination? Because her symptoms don't fit anymore. A silence filled the room. Thomas looked from the doctor to the nurse. Emma could feel the tension. She knew exactly what was happening. The doctor believed the case was already solved. Emma believed the case had never been solved at all. You're 4 months into nursing, Mercer said. I've been treating pediatric patients for years. Emma nodded. I know. Then trust the diagnosis. Emma looked at Sophie again. The child had closed her eyes. Sophie, Emma said softly. The little girl opened them. Can you tell me your favorite animal? Dolphin. Dolphins are beautiful. Can you count backward from 10? 10. Good. 9. Good. 9. Emma froze. Sophie had repeated the number. The child did not realize it. Thomas did not realize it. Mercer did not realize it. But Emma did. She had seen that before. Repeating an answer. Difficulty staying focused. Unusual sleepiness. Vomiting. Headache. Fever. A sluggish pupil. Pain behind the ear. And now the strange skin discoloration. The pieces were beginning to connect. Emma looked at Dr. Mercer. I don't think this is just an ear infection. Mercer gave a short laugh. Then what do you think it is? Emma took a breath. Mastoiditis with possible intracranial extension. The doctor's smile disappeared. You are suggesting a brain complication? Yes. Based on what? The symptoms. Those symptoms can occur with an ear infection. Not together like this. Thomas stepped forward. What are you saying? Emma turned toward him. I think the infection may have moved beyond the middle ear and into the bone behind it. If it has spread farther, there could be pressure building near the skull. Thomas stared at her. Is that dangerous? Very. Mercer immediately interrupted. Admiral, please don't panic. There is no evidence yet that your granddaughter has an intracranial abscess. Emma nodded. That's exactly why we need the right imaging. Mercer shook his head. We already have imaging. Of the ear canal. He stopped. Emma continued. The earlier images don't give us a complete look at the mastoid area. Mercer stared at the screen. For the first time, his confidence seemed less certain. Emma could see it. A tiny pause. A tiny hesitation. A moment when even an experienced doctor wondered whether he had missed something. Thomas looked at him. Doctor, should we get another scan? Mercer looked annoyed. But Thomas's voice had changed. It was not the voice of a worried grandfather anymore. It was the voice of a military commander. Get the scan, Thomas said. Emma stayed beside Sophie. She held the little girl's hand. You're doing great. Will it hurt? No. You just need to stay very still. Is Grandpa coming? He'll be right here. Thomas moved closer. I'm not going anywhere. The imaging technician prepared the equipment. The room became quiet. Emma watched the monitor. Sophie was becoming sleepier. Too sleepy. Stay awake for me, Emma whispered. I'm tired. I know, sweetheart. But stay with me a little longer. What animal do you like? Emma smiled. Dolphins. Me too. Sophie smiled weakly. The scan began. Emma stood behind the glass with Thomas. Dr. Mercer waited nearby with his arms crossed. Nobody spoke. For minutes passed. Then the images appeared. The technician stopped moving. His face changed. Dr. Mercer immediately noticed. What is it? The technician enlarged the image. There, behind the right ear, was an abnormal pocket. Fluid. Swelling. Pressure. The infection had spread into the mastoid region. And there were signs that it was beginning to extend toward the space inside the skull. Dr. Mercer stared at the image. His voice became quiet. That's an abscess. Emma did not celebrate. She did not smile. She did not say, I told you so. There was no time for that. She needs neurosurgery, Emma said. Thomas looked at her. Now. Sophie suddenly became less responsive. Emma immediately moved toward the child. Her breathing had changed. Her oxygen level was beginning to fall. She's deteriorating. A resident looked at the monitor. It's still within acceptable range. Not for her current condition. Emma adjusted Sophie's position carefully. Raise her head slightly. The resident hesitated. Emma looked directly at him. Please. He followed her instruction. Dr. Mercer watched her. Where did you learn that positioning? Emma kept her eyes on Sophie. Experience. What kind of experience? Emma did not answer. Thomas did. She has something in her background you don't know about. Mercer looked at him. What? Thomas stared at Emma. You tell him. Emma finally looked up. I used to work in military rescue medicine. The room went silent. Mercer blinked. Military. Emma nodded. Air Force. Thomas's eyes narrowed. How long? For years. Rescue. Yes. Thomas studied her face. Suddenly several things made sense. The controlled movements. The calm voice. The way she recognized subtle changes. The way she never panicked when everyone else did. You were a pararescueman? Emma nodded. I was. Mercer stared at her. Why didn't you tell anyone? Because I didn't come here to be treated differently. She looked back at Sophie. I wanted to be judged by the work I did here. That answer silenced him. A few minutes later, the neurosurgical team arrived. Dr. Nadia Rahman entered the room carrying a tablet. She looked at the scan. Then she looked at Sophie. Then she looked at Emma. Who noticed the neurological changes? Emma raised her hand slightly. I did. Dr. Rahman nodded. Good catch. She turned toward the team. We need to drain this before it progresses. Thomas moved closer. How serious is it? Dr. Rahman looked directly at him. Serious enough that we don't want to wait. Sophie was taken toward surgery. Thomas walked beside her bed. Emma stayed behind. She watched the doors close. And only after they disappeared did her hands begin to shake. She walked into an empty supply room, closed the door, leaned against the wall, and slowly slid down until she was sitting on the floor. For 4 months, Emma had been the quiet nurse. The new nurse. The person who asked questions and was told to wait. The person who took notes while senior doctors made decisions. But now she was remembering another time when she had noticed something too late. A man named Daniel Reyes. Her closest teammate. Her friend. Her brother in every way that mattered. Years earlier, Daniel had been injured during a dangerous rescue operation. Emma had recognized the warning signs. She had known something was happening inside his head. But help was too far away. Weather delayed the evacuation. Communications failed. There was no advanced hospital nearby. No specialists waiting behind a door. No operating room. No backup. Only a small medical kit, a few exhausted people, and time running out. Daniel died during evacuation. Emma never forgot the feeling of holding his hand while knowing she could not stop what was happening. That memory followed her out of the military. It followed her into nursing school. And it followed her into Coastal Valley Hospital. She had thought nursing would be different. Quieter. Safer. More controlled. She had been wrong. Because emergencies did not care what uniform a person wore. And sometimes the difference between life and death was simply one person deciding not to ignore what they were seeing. A knock came at the door. Emma. It was Dr. Mercer. She wiped her eyes quickly. Yes. Can I come in? She opened the door. He looked different. Not angry. Not confident. Just tired. She's in surgery, he said. How is she? They're working on her now. Emma nodded. Mercer looked at the floor. You were right. Emma said nothing. I should have listened. Still she said nothing. I dismissed you. You did. He swallowed. I was wrong. Emma looked at him. I don't need an apology right now. I know. Just make sure you listen next time. He nodded. I will. Then he walked away. Emma remained in the doorway. For the first time since she had joined the hospital, she realized something important. Being new did not mean being incapable. Being young did not mean being foolish. And being quiet did not mean having nothing valuable to say. Sometimes the person with the least authority in the room could still have the most important observation. And sometimes courage was not shouting. Sometimes courage was simply speaking one more time after everyone else had told you to be quiet. If you are still with Emma's story, leave a like, subscribe for more emotional stories, and share this video with a friend who needs to remember that experience can come in unexpected forms. Your support helps keep these stories alive. Nearly an hour passed. Thomas sat outside the operating room. His military posture had disappeared. He looked like a grandfather again. Emma sat several seats away. Neither spoke for a long time. Finally Thomas said, "You knew." Emma looked at him. "I suspected. You saw something nobody else saw." "I noticed a pattern." "Where did you learn to notice things like that?" Emma looked down. "From losing someone." Thomas understood immediately. He had lost people too. 31 years in the Navy had taught him that every uniform eventually carried a list of names. "Was it during your service?" "Yes." "Someone close?" "My teammate." Thomas nodded. "I am sorry." "So am I." The doors finally opened. Dr. Rahman stepped out. For one terrifying second, her expression gave nothing away. Then she smiled. "She's going to be okay." Thomas stood immediately. "What?" "We drained the abscess before it reached the major venous channel. There is no evidence of a stroke. Her neurological response is encouraging." Thomas closed his eyes. A breath escaped him. The kind of breath a person releases only after holding it for too long. "Thank you." Dr. Rahman shook her head. "Thank Emma." Thomas turned toward her. His eyes filled with tears. He walked over. "You saved my granddaughter." Emma shook her head. "The team saved her." "But you made sure the team had the chance." Emma had no answer to that. Thomas extended his hand. Emma shook it. It was not the handshake of an admiral and a nurse. It was the handshake of two people who understood what it meant to carry responsibility when lives were involved. Hours later, Sophie opened her eyes. She looked around the room. Her grandfather was asleep in a chair beside her. Emma stood near the bed. Sophie blinked. "Dolphin lady?" Emma smiled. "Hey, brave girl." "My head feels funny." "That's okay." "Did I miss anything?" Thomas suddenly woke. "You missed your entire grandfather having a nervous breakdown." Sophie frowned. "Grandpas don't have nervous breakdowns." Thomas laughed. "Apparently they do." Emma smiled. Sophie reached for her hand. "Can I have a dolphin?" "I think you already have one." Sophie looked at the stuffed dolphin sitting beside her. "This one." "That's a good one." "Can you stay?" Emma nodded. "For a little while." And she did. She stayed until Sophie fell asleep again. She stayed because she knew what it meant for a child to wake up in a hospital and search for one familiar face. She stayed because once years ago, someone had stayed beside her when she needed it. And she stayed because sometimes saving a life did not end when the emergency ended. Sometimes it meant simply being there afterward. The next morning, the hospital began asking questions. How had the diagnosis been missed? Why had the earlier visits not triggered further investigation? Why had the child's unusual neurological symptoms been documented, but not acted upon? And most importantly, why had nobody listened to the nurse who was closest to the patient? The answers were uncomfortable. The first diagnosis had created a pattern. Once everyone believed it was an ear infection, every new symptom was interpreted through that belief. The fever belonged to the infection. The vomiting belonged to the infection. The sleepiness belonged to the child's age. The headache belonged to the illness. Everything had an explanation. Except the patient was getting worse. Emma had not looked at the diagnosis first. She had looked at Sophie first. That difference saved her life. Dr. Mercer eventually presented the case to the hospital staff. He did not hide his mistakes. He explained exactly where the team had failed. He admitted that Emma had raised concerns multiple times. He admitted that he had dismissed them. And he told the room something many doctors rarely like to hear. The person closest to the patient may notice something the rest of us miss. The room stayed quiet. Emma stood near the back. She did not want applause. She did not want recognition. She simply wanted the lesson to survive. Weeks later, Sophie's grandfather returned to the hospital. This time he was not wearing his full military uniform. He wore ordinary clothes. Sophie was with him. She had recovered remarkably well. She still had a small scar behind her ear. Her hair was growing around it. She carried a stuffed dolphin under one arm. When she saw Emma, she ran toward her. "Dolphin lady." Emma crouched down. "How are you?" "I'm good." "Any headaches?" "No." "Any vomiting?" "No." "Are you still going to become a doctor?" Sophie thought about it. "No." Emma laughed. "I'm going to be a dolphin trainer. That's a much better plan." Sophie handed Emma a piece of paper. It was a drawing. Two people stood beside a dolphin. One wore blue scrubs. The other wore a pink shirt. Above them, in uneven handwriting, were the words, "Thank you for listening." Emma stared at the drawing. Her eyes became wet. She hugged Sophie gently. That small piece of paper became one of the most important things Emma owned. Not because it was an award. Not because an admiral had given it to her. Not because it appeared in the news. It mattered because a 5-year-old child understood something the adults in the room had forgotten. Someone had listened. And sometimes being listened to is the beginning of being saved. Months later, Emma was still working at the hospital. She did not become famous. She did not suddenly become the most respected person in the building. She was still a nurse. She still worked long shifts. She still cleaned rooms, checked vital signs, answered call buttons, changed dressings, and comforted frightened families. But something had changed. Doctors began asking her questions. New nurses came to her when they were unsure whether to speak up. Residents learned that Emma did not care about proving anyone wrong. She cared about getting the patient right. Dr. Mercer changed too. Not overnight. Not perfectly. But he began asking the nursing staff what they had noticed before starting rounds. It was a small change. Yet small changes can become important ones. One afternoon, a young resident stopped Emma in the hallway. "Can I ask you something?" "Sure." "I keep worrying that I'm going to say something stupid." Emma smiled. "You will." The resident looked surprised. Emma laughed softly. "So will I. So will every doctor here." "Then how do you know when to speak?" "You don't always know." "That doesn't help." "It isn't supposed to." Emma leaned against the wall. "You ask yourself one question." "What question?" "Am I speaking because I actually saw something? Or because I'm afraid of being ignored?" The resident thought about it. "And if I actually saw something? Then speak." "What if the attending says I'm wrong?" "Speak again." "What if everyone else disagrees?" Emma smiled. "Then make sure your facts are clear and speak again." The resident nodded. Emma watched her walk away. That was when she understood the real meaning of everything that had happened. The greatest thing she had carried out of military service was not a medal. It was not a title. It was not a skill that could be written on a resume. It was the willingness to look twice. To question the first answer. To notice the tiny detail that did not belong. And to keep asking when something felt wrong. Emma still missed Daniel. She always would. There were nights when a difficult case brought back memories she thought she had buried. But the memories no longer controlled her. They reminded her. They sharpened her attention. They gave meaning to the quiet work she had chosen. She had once believed leaving the military meant leaving behind the part of herself that mattered. Now she understood. She had not lost that part of herself. She had simply carried it somewhere else. She had exchanged a battlefield for a hospital, a rifle for a penlight, a helicopter for an ambulance, and loud emergencies for quiet moments where one careful observation could change everything. Sophie grew up with a small scar behind her ear. She probably would not remember most of what happened. She would remember being sick. She would remember her grandfather. She might remember a nurse who called her a brave girl. But she would not remember how close she came to losing everything. Her grandfather would remember. Emma would remember. The doctors would remember. And the hospital would remember. Because the story was never really about a rookie nurse proving 8 doctors wrong. It was about something much more important. It was about listening. It was about humility. It was about understanding that knowledge can come from unexpected places. And it was about recognizing that the person with the least authority in a room can sometimes carry the most important piece of information. Emma never wanted to be called a hero. She believed heroes were people who simply did what needed to be done. On that day, she saw a sick child. She noticed something unusual. She spoke. She refused to stop. And because she did, a little girl went home. That was enough. Years later, Thomas Hale would still tell the story at family gatherings. Each time, the story became slightly more dramatic. Sometimes he claimed Emma recognized the problem before the scan even started. Sometimes he said she had known the exact diagnosis the moment she entered the room. Emma always laughed when she heard the stories. She never corrected him. Because underneath all the exaggeration was one simple truth. She had looked behind the ear. 8 doctors had looked at the ear. Emma had looked beyond it. And that tiny difference changed everything. So if there is one lesson to carry from Emma's story, let it be this. Never confuse quietness with weakness. Never confuse youth with ignorance. Never assume the newest person in the room has nothing to teach you. And never ignore a small detail simply because the larger picture seems familiar. Sometimes the most dangerous mistake is not failing to see something. It is seeing something unusual and deciding it does not matter. Emma decided it mattered. And because she did, Sophie lived. Emma Carter kept her eyes on the little girl as the room slowly filled with tension. Sophie Bennett was only 5 years old, but the expression on her face made her look much older. She was exhausted. Her small fingers remained pressed behind her right ear, and every few seconds she closed her eyes as if even keeping them open required too much effort. Emma had only been a nurse at Coastal Valley Hospital for 4 months. 4 months was enough to learn the routines, enough to understand the alarms, enough to know which doctors wanted detailed explanations, and which ones wanted only the important facts. But 4 months was not enough to make people forget that she was new. And Dr. Adrian Mercer clearly remembered. He stood beside the examination monitor, arms folded, looking at Emma as though she had just interrupted something obvious. "It's an ear infection," he repeated. Emma looked down at her tablet. "I understand, doctor." "Then stop searching for something that isn't there." Emma looked at Sophie again. The little girl opened her eyes. For a second, their eyes met. Emma saw fear. Not ordinary fear of a hospital. Not fear of doctors. Something deeper. Sophie looked frightened, because she knew something inside her body was changing. Emma moved closer. "Sweetheart, can you tell me when the pain gets worse?" "When I lie down." "Only when you lie down?" Sophie nodded. "And when I wake up?" Emma's eyes moved toward Thomas Hale. "Has she been waking up during the night?" "Several times." "How long?" "3 nights." Mercer sighed. "That can happen with ear infections." Emma nodded again. But she did not stop. "Has she complained that her head feels strange?" Thomas hesitated. "Yes." "What did she say?" "She said it felt full." Emma felt her heartbeat change. A quiet warning. She had heard that phrase before. Not from a child. From a soldier. And the memory was not one she wanted to revisit. She pushed it away. "Has she been confused?" Thomas looked at Sophie. "Yesterday she called me by my first name." Mercer frowned. "Children do strange things when they're sick." Emma looked at him. She also repeated the number 9. Mercer stared at her. "What?" "During the counting test." The doctor looked toward Sophie. Emma continued. She said 10, then 9, then 9 again. The room became quiet. Thomas moved closer. "Is that important?" "It can be." Emma did not want to frighten him. But she also refused to make the mistake of hiding information simply because it might make someone uncomfortable. She had learned that lesson long ago. If you are enjoying the story so far, tap like, subscribe to the channel, and share this video with someone who believes every warning deserves to be heard. Your support helps us bring more stories of quiet courage to you. Mercer walked toward Sophie. "Let's repeat the neurological check." Emma stepped aside. The doctor checked her pupils. He checked her responses. He asked simple questions. Sophie answered some. Others she ignored. Mercer looked at the monitor. For the first time, he did not immediately speak. Emma watched him. She knew that look. He was beginning to see it. Not the entire picture. Not yet. But enough to realize that the case was not as simple as he had believed. Get another scan, Mercer finally said. The technician prepared the equipment. Thomas stood beside Sophie. Emma stayed close. The child looked up at her. Are you a doctor? No. Then what are you? I'm a nurse. Do nurses know everything? Emma smiled. No. Nobody knows everything. Sophie thought about that. Then how do you know? Emma paused. Sometimes you just notice something. What? Something small. Sophie touched the area behind her ear. Like this. Emma's expression changed. Exactly like that. The scan began. Everyone watched the screen. Emma felt the old tension building in her chest. The same tension she had experienced during rescue missions. The feeling that time was moving faster than everyone realized. She counted silently. 1, 2, 3, 4, 5. The images appeared. The technician zoomed in. His face changed. Mercer noticed. What? The technician swallowed. You should look at this. Mercer stepped closer. Thomas moved beside him. Emma stayed behind them. On the screen was the answer. The infection had moved beyond the middle ear. The bone behind the ear was involved. There was swelling. There was fluid. And the dangerous part was that the infection was extending toward the skull. Mercer stared. This isn't possible. Emma looked at him. It is. He looked back at the scan. She's had 8 visits. I know. How did we miss this? Emma answered quietly. Because everyone was looking for the same thing. Mercer turned toward her. What do you mean? Everyone expected an ear infection, so everyone kept looking at the ear. She pointed toward the image. Nobody looked beyond it. Thomas stared at the scan. What happens now? Emma looked at him. Now we move quickly. The room suddenly became active. Phones started ringing. People moved through the doorway. A nurse called neurosurgery. Another nurse contacted anesthesia. The pediatric emergency team arrived. For the first time that day, nobody was questioning Emma. Everyone was moving. Sophie was transferred onto another bed. Emma stayed beside her. Don't close your eyes yet. I am sleepy. I know. Can I sleep? Not yet. Why? Because I need you to keep talking to me. About what? Your dolphin. Sophie smiled weakly. I saw one on TV. Was it big? Very big. Bigger than your grandfather? Sophie looked at Thomas. Yes. Thomas smiled. That's not difficult. Sophie laughed. It was a tiny laugh. But Emma noticed it. The child was still responsive. That mattered. Then the monitor changed. Emma immediately looked up. Her oxygen level is dropping. A resident looked at the screen. Still acceptable. Emma shook her head. Her trend is going down. The resident looked at her. It's only a few points. Emma answered calmly. A few points can become a serious problem very quickly. She adjusted Sophie's position. Keep her head elevated. Thomas watched her hands. There was something different about Emma now. She was still gentle. Still calm. But her movements were precise. No guastidmotion. No hesitation. No panique. Thomas had seen that kind of movement before. On ships. In combat. During emergencies. He turned toward her. Emma. She looked at him. Where did you learn to do that? She did not answer immediately. I had medical training before nursing. Military. Yes. What branch? Air Force. Thomas stared at her. Rescue. Emma nodded. How long? For years. He looked at her hands again. That explains it. Emma looked away. It explains some things. Why didn't you tell the hospital? Because I wanted to start over. Thomas understood. He had seen people leave military service carrying things nobody else could see. Some people carried medals. Some carried memories. Some carried both. Emma carried memories. Especially one. A man named Daniel Reyes. Her teammate. Her friend. The person she had once promised she would never leave behind. The memory returned without warning. A remote valley. A damaged vehicle. A wounded team member. Blood. Dust. A radio that would not connect. Daniel's breathing becoming weaker. Emma had recognized the warning signs. She had known something was happening inside his head. But knowing had not been enough. The evacuation helicopter was delayed. The weather had turned dangerous. Every minute mattered. And Emma had watched Daniel slip away while she held his hand. That night changed her. For months afterward, she blamed herself. Maybe she should have done something differently. Maybe she should have noticed earlier. Maybe she should have fought harder. Maybe she could have saved him. Eventually, she left the military. She entered nursing school. She told herself that hospitals would be different. Here there would be equipment, specialists, doctors, operating rooms, backup. She thought she would finally be safe from that feeling. The feeling of knowing something was wrong while everyone else remained calm. But now, standing beside Sophie, she realized the feeling had followed her. The difference was that this time she had been heard. The neurosurgical team arrived. Dr. Nadia Rahman entered quickly. She looked at the scan. Then she examined Sophie. Then she looked at Emma, who noticed the neurological changes. Emma raised her hand. I did. Dr. Rahman nodded. Good. She turned to the team. Prepare the operating room. Thomas stepped forward. How long? As quickly as we can safely do it. Will she survive? Dr. Rahman looked at him. We caught it before the worst complication occurred. Thomas closed his eyes. Thank God. Emma stood beside Sophie. The little girl reached for her hand. Emma took it. I don't want you to leave. I'm not leaving yet. Promise. I promise. Sophie squeezed her finger. Then the bed began moving. Emma walked beside her. Thomas followed. The doors to the surgical area opened. And then they closed. Emma stopped. For a few seconds she simply stood there. The hallway was quiet again. But inside her head, it was not quiet. She heard an old helicopter. An old radio. An old voice. Daniel. She remembered the last thing he had said to her. She remembered promising that she would get him home. She remembered failing. Her hands began shaking. Emma quickly walked into a small supply room. She closed the door. Then she leaned against the wall. The tears came before she could stop them. She had spent years trying to convince herself that she had moved on. But she had not. She had simply learned how to function while carrying the memory. A knock came at the door. Emma wiped her face. Who is it? It's Dr. Mercer. She opened the door. He stood there quietly. For once, he did not look like the most confident person in the building. He looked like a man who had learned something difficult. She's in surgery, he said. How is she? They're working on her. Emma nodded. Mercer looked uncomfortable. I owe you an apology. Emma looked at him. You do. I dismissed you. Yes. I shouldn't have. No. He looked down. I thought because I had more experience, I couldn't be wrong. Emma said nothing. That was arrogant. Emma finally answered. Experience is valuable. Mercer looked at her. But experience should make you better at listening, not worse. The words stayed between them. Mercer nodded slowly. I'll remember that. Emma looked toward the hallway. Just make sure you remember it when the next nurse speaks. He nodded. I will. He walked away. Emma stayed there for another moment. Then she returned to the waiting area. Thomas was sitting alone. He looked exhausted. Emma sat across from him. Neither spoke. After several minutes, Thomas finally asked, Was it Daniel? Emma looked at him. How did you know his name? You mentioned him earlier. Emma nodded. He was my teammate. Thomas looked down. I'm sorry. I still think about him. That's normal. People say that. They're right. Emma looked at him. How many people have you lost? Thomas took a slow breath. More than I can remember without trying. Does it get easier? No. Emma looked surprised. Thomas continued. You just learned how to carry it. Emma nodded. That answer felt more honest than anything anyone had told her before. Thomas looked toward the operating room. My granddaughter is alive because you refused to stay quiet. Emma shook her head. She's alive because the doctors operated. They operated because you spoke. Emma did not argue. For once, she allowed herself to accept the truth. She had spoken. She had noticed. She had acted. And this time, someone had listened. A few hours later, the operating room doors opened. Dr. Rahman walked out. Thomas stood immediately. Emma stood too. Dr. Rahman pulled down her mask. She's stable. Thomas's face changed. Stable? Yes. Is she going to be okay? We believe so. Thomas closed his eyes. Emma finally let herself breathe. Dr. Rahman looked at her. Good work. Emma nodded. Thank you. No, Dr. Rahman said. Thank you. Emma looked surprised. If you had waited another few hours, the outcome could have been very different. Thomas looked at Emma. The Admiral did not say anything. He did not need to. His eyes said enough. The little girl had been given another chance. And the nurse everyone had dismissed had been the person who noticed the one detail everyone else overlooked. The story was only beginning. And neither Emma nor the hospital yet understood how much this one case was about to change them. The morning after Sophie's surgery, Coastal Valley Hospital felt strangely different. Nothing about the building had changed. The same fluorescent lights were glowing above the hallways. The same carts rolled across the polished floors. The same monitors beeped behind closed doors. Nurses still hurried between rooms. Doctors still carried tablets and coffee. Families still sat in waiting areas, hoping for good news. But inside the pediatric department, something had changed. People were talking. Not loudly. Not openly. But everywhere Emma Carter walked, conversations became quieter. She could feel people looking at her. Some were curious. Some were impressed. Others were uncomfortable. And a few were clearly wondering how a nurse who had been working for only 4 months had noticed something that experienced doctors had missed again and again. Emma tried to ignore it. She did not want attention. She had never wanted attention. She had spent years learning how to work quietly. She believed that good medical care was not about who received credit. It was about whether the patient went home alive. Still, the story had already spread. 8 doctors had called it an ear infection. A new nurse had noticed something different. A vice admiral's granddaughter had nearly died. And one tiny observation had changed everything. Emma entered the nurse's station carrying a fresh chart. Her coworker Rachel Monroe looked up. You know everyone is talking about you. Emma sighed. I was hoping they weren't. Rachel laughed. That's impossible. Emma placed the chart on the desk. What are they saying? Depends on who you ask. That's encouraging. Some people say you're a genius. Emma rolled her eyes. Definitely not. Others say you got lucky. Emma nodded. That sounds more realistic. Rachel leaned closer. And some people are saying you had military medical training. Emma stopped moving. Who told them? Rachel raised both hands. I don't know. Hospital gossip moves faster than the emergency department. Emma looked down the hallway. She had hoped to keep her past separate from her present. That was no longer possible. Rachel noticed her expression. Is that a problem? Emma shook her head. I just wanted to be a nurse here. You are a nurse here. I know. Then what's the difference? Emma thought about it. The difference is that now people are going to expect me to be something else. Rachel smiled. Maybe you don't have to be anything except yourself. Emma looked at her. Rachel continued. You saved a child. I helped. You helped enough. Emma smiled slightly. That's not how this works. Maybe it should. Before Emma could respond, an overhead announcement called for assistance in the pediatric wing. Both nurses immediately stood. They walked toward the room. A young boy was crying beside his mother. His temperature was elevated, and the mother looked terrified. Emma crouched beside the child. What's your name? Leo. Leo. I'm Emma. The boy looked at her. Are you the nurse who saved the little girl? Emma froze. Rachel looked away, trying not to smile. Emma smiled gently. Who told you that? My mom. The mother looked embarrassed. I'm sorry. I didn't mean. It's okay. Leo looked at Emma. Are you a superhero? Emma shook her head. No. Why? Because superheroes don't get tired. Rachel laughed from behind her. Emma continued examining Leo. How long has he had a fever? Since last night. Any vomiting? No. Headache? A little. Emma nodded. She carefully examined him. She did not assume anything. She did not decide what the diagnosis was before completing the assessment. That was one of the lessons she had learned from Sophie's case. Never let the first answer stop you from asking another question. Later that afternoon, Dr. Adrian Mercer walked into the nurse's station. The conversation stopped. He looked around. Emma? She looked up. Yes. Can we talk? Emma followed him into an empty consultation room. He closed the door. I've been reviewing Sophie's chart. Emma waited. There were warning signs in the earlier notes. Yes. I didn't see them. Emma remained silent. Mercer looked uncomfortable. I want to understand why. Emma pulled out a chair. Then look at the whole timeline. He sat down. She opened the record. Her symptoms didn't appear all at once. She pointed to the first visit. At the beginning, the ear infection diagnosis made sense. Then she moved to the second visit. Here, the fever continued. Third. Here, she developed repeated vomiting. Fourth. Here, her sleep pattern changed. Fifth. Here, she complained of pain behind the ear. Sixth. Here, her headache became more frequent. Seventh. And here, the family reported that she was acting differently. Mercer stared at the screen. And none of those alone seemed serious. Exactly. Emma looked at him. But together, they were a different story. Mercer nodded slowly. Pattern recognition. Yes. That's what you were doing. I was listening to the changes. Mercer leaned back. I think I made the mistake of treating every visit as a separate event. Emma nodded. That's easy to do. Why? Because hospitals are busy. She continued. Every day you see hundreds of symptoms. You start looking for the fastest explanation. And once you find one, you stop looking. Mercer looked at the chart. That's dangerous. It can be. He closed the file. How did you learn to avoid it? Emma looked toward the window. Training. Military training? Partly. And experience? Mostly. Mercer hesitated. Tell me about it. Emma looked back at him. No. He nodded. She appreciated that he did not push. You don't have to tell me. I know. There was a long silence. Then Mercer said something unexpected. I want you to teach the residents. Emma frowned. Teach them what? How you approach patients. I'm a new nurse. You're the nurse who caught something the rest of us missed. That doesn't make me a teacher. It means you have something worth sharing. Emma considered it. I don't want to teach them how to be me. Then teach them how to look. That sentence stayed with her. Teach them how to look. It sounded simple. But it was not. Because looking was different from seeing. Anyone could look at a patient. Seeing required attention. Seeing required patience. Seeing required the willingness to question what appeared obvious. And Emma had learned that lesson the hardest way possible. That evening, she visited Sophie. The little girl was awake. Her eyes were clearer. Her voice was stronger. Thomas was sitting beside her. When Emma entered, Sophie smiled. Dolphin lady. Emma laughed. You remember me? I remember everybody who gave me medicine. Thomas smiled. She has been negotiating with the nurses all morning. She's very persuasive. She gets that from her mother. Sophie looked at Emma. Can I go home? Not yet. She frowned. Why? Because your doctors want to make sure you're strong enough. But I'm strong. Thomas nodded. Very strong. Sophie pointed at him. Grandpa is weaker. Thomas pretended to be offended. I am not weak. You cried. Emma tried not to laugh. Thomas looked at her. Don't encourage her. Sophie smiled. The room felt normal. That was what Emma liked. Normal. No emergency. No alarms. No surgeons running down hallways. Just a child talking about going home. Emma checked her vitals. Everything looked better. Then she noticed the small bandage behind Sophie's ear. A reminder of how close they had come. Sophie reached toward it. Will the scar go away? Maybe not completely. Will people see it? Only if you show them. Sophie thought about that. I'm going to tell everyone. Emma smiled. Then it becomes your story. Thomas looked at Emma. You have one too. Emma knew what he meant. Her scar was not on her skin. It was somewhere deeper. Before she could answer, Thomas's phone rang. He stepped outside. Emma continued talking to Sophie. A few minutes later, Thomas returned. His expression was serious. Emma, can I speak with you outside? Emma followed him. What happened? The Navy Medical Command wants the details of the case. Emma frowned. Why? Because the patient was my granddaughter. That's not enough. Thomas smiled slightly. No. But the case has become important. Why? Because there are questions about how often similar complications are missed. Emma crossed her arms. Are they investigating the hospital? They are reviewing the case. Emma looked uncomfortable. I don't want to be part of a political issue. You won't be. How do you know? Because I won't let them use you. Emma looked at him. He spoke with the confidence of someone used to protecting people under his command. But Emma was not his sailor. She was a nurse. I can protect myself. I know. Thomas smiled. That's one of the reasons I respect you. Emma looked away. I don't want special treatment. You won't get it. Good. But I do want you to understand something. What? You have a skill people need. Emma shook her head. I was just doing my job. That's what good people always say. Emma smiled. Maybe because it's true. Thomas looked at her. Maybe. He paused. Have you ever thought about teaching? Emma remembered Mercer's words. Teach them how to look. Maybe. Thomas nodded. Then think seriously. That night, Emma drove home after her shift. The city was quiet. She parked outside her apartment and sat in the car for several minutes. She did not want to go inside yet. She looked at her reflection in the rearview mirror. For months as a nurse. For years in military rescue. 2 different lives. 1 person. She wondered whether she had spent too much time trying to separate them. Maybe the 2 lives were not enemies. Maybe they were pieces of the same person. She remembered something her instructor had told her during military training. Never fall in love with your first explanation. At the time, she had thought it was simply a field medicine rule. Now she understood it differently. It was a rule for life. Your first explanation could be wrong. Your first impression could be wrong. Your first judgment could be wrong. And sometimes, the cost of refusing to question it could be enormous. Emma finally got out of the car. Inside her apartment, she made tea. She sat near the window. For the first time in years, she allowed herself to think about Daniel without immediately pushing the memory away. She remembered his laugh. His terrible jokes. The way he always complained about cold coffee. The way he could make everyone smile during impossible situations. She remembered the night he died. But this time, another image appeared beside it. Sophie. Alive. Smiling. Holding a stuffed dolphin. Emma closed her eyes. Maybe Daniel's story had not ended the way she wanted. But maybe the lesson had not ended with him either. Maybe every life she helped save after that was part of the promise she had made. The next morning, Emma received an unexpected message. Dr. Nadia Rahman wanted to meet her. Emma arrived at the neurosurgery office after her shift. Dr. Rahman was reviewing Sophie's follow-up results. She's recovering well, she said. Emma smiled. That's good. Very good. Dr. Rahman closed the file. I also wanted to speak to you about something else. Emma waited. I know about your military background. Emma sighed. Everyone knows now. Not everyone. Enough people. Dr. Rahman smiled. I'm not interested in the story. Emma looked surprised. What are you interested in? Your method. My method? Yes. You mean how I examined her? How you thought? Emma sat down. Dr. Ramon continued. You didn't jump to the rare diagnosis. Emma nodded. You started with what was in front of you. Yes. Then you noticed that the pattern didn't fit. Exactly. That's what I want residents to learn. Emma looked at her. I don't know if I can teach that. You already did. Emma smiled. How? You made the rest of us look again. Dr. Ramon stood. That is rare. Emma thought about it. Maybe this was why she had become a nurse. Not because it was smaller than her old life. Not because it was safer. But because it allowed her to stay close to people. Close enough to notice. Close enough to listen. Close enough to catch the small things. She finally understood. She had not left one life behind. She had carried its lessons into another. And perhaps that was the real reason Sophie had survived. Not because Emma was secretly extraordinary, but because she had learned never to stop looking. If this part of the story made you think about someone whose warning was ignored until it was too late, take a second to like the video, subscribe to the channel, and share it with them. Sometimes one shared story can remind someone that their voice has value. A week later, the hospital held a review meeting. Doctors, nurses, residents, administrators. Everyone gathered in a large conference room. The case was displayed on a screen. Sophie's timeline appeared 1 visit at a time. 8 visits. 8 opportunities. 1 missed pattern. Emma sat quietly near the back. She had no intention of speaking unless asked. Dr. Mercer stood at the front. He looked at the room. I want to begin by saying something uncomfortable. Everyone became quiet. I was wrong. No excuses. No explanation. No attempt to blame anyone else. Just 2 words. I was wrong. Mercer continued. I believe the initial diagnosis explained the entire case. I allowed that belief to shape every later decision. He clicked to the next slide. By the 7th visit, the patient had developed multiple warning signs. Another slide. Those signs were documented. Another. But they were not integrated into a larger picture. He paused. Then he looked toward Emma. Nurse Carter noticed the pattern. Everyone turned. Emma felt dozens of eyes on her. She hated it. But she stayed seated. Mercer continued. She raised her concern. He paused. I dismissed it. The room became even quieter. She raised it again. Another pause. I dismissed it again. Emma looked down. Mercer faced the room. This is not a story about a nurse being smarter than doctors. Emma looked up. It is a story about a medical team failing to listen. That sentence mattered. Because it changed the story. The problem was not that doctors were stupid. They were not. The problem was that everyone had become comfortable with the first answer. And comfort can be dangerous. Mercer continued. Our responsibility is not to defend the diagnosis. He looked around the room. Our responsibility is to defend the patient. For the first time since Sophie entered the hospital, Emma felt something inside her loosen. Maybe the lesson would remain. Maybe someone else would hear it. Maybe another child would benefit. The meeting continued for nearly 2 hours. Questions were asked. Mistakes were examined. Protocols were changed. A new process was introduced requiring nurses' neurological observations to be reviewed during pediatric reassessments. It was a small policy change. But Emma knew small changes could save lives. After the meeting, Dr. Mercer approached her. Thank you. Emma smiled. For what? For not giving up. Emma looked at him. I almost did. He frowned. What? There were moments I thought you were right. Mercer looked surprised. Emma continued. That's why I kept checking. He smiled. Well, I'm glad you didn't stop. So am I. They walked down the hallway together. For the first time, Emma did not feel like the rookie nurse. She felt like part of the team. Not because she had proved herself, but because she had learned something everyone in that hospital needed to remember. The patient came first. Always. And sometimes the person who notices the truth first is not the person with the most letters after their name. Sometimes it is the person standing quietly at the bedside, watching, listening, and refusing to look away. The meeting ended, but the lesson did not. Long after the doctors had left the conference room, Emma Carter remained in her chair, staring at the final image on the screen. It was the scan that had changed everything. A small dark area behind Sophie's ear. A place that had been there before anyone noticed it. A place that had been silently growing while everyone around the little girl believed they already knew what was wrong. Emma looked at the image one last time before standing. She knew something important had happened that day, but she also knew the hospital would not change because of one meeting. Real change took time. It required people to remember what they had learned when the next difficult patient arrived. As Emma walked back toward the pediatric floor, she passed Dr. Mercer. He stopped. "Emma." She turned. "Yes. I wanted to ask you something." "What?" "When you first noticed something was wrong with Sophie, were you completely certain?" Emma smiled faintly. "No." Mercer looked surprised. "You weren't?" "No." "Then why did you keep pushing?" Emma thought for a moment. "Because I was more certain that something didn't fit than I was certain about what the diagnosis was." Mercer remained quiet. Emma continued. "That's the difference." "What difference?" "You don't always need to know exactly what is happening before you admit that something isn't right." Mercer slowly nodded. That sentence stayed with him. It stayed with Emma too, because it was one of the most important lessons she had learned in both of her lives. You could be uncertain about the answer, and still be certain that another question needed to be asked. That afternoon, Emma returned to the pediatric floor. The department was busy again. A toddler was crying. A father was arguing with a registration clerk. A monitor was beeping in one of the rooms. A resident was running down the hallway with a stack of papers. It looked like every other day, but Emma knew it wasn't. She had begun to notice small changes. Nurses were talking more. Doctors were asking more questions. Residents were spending longer at the bedside. Nobody wanted another Sophie. Nobody wanted another patient whose warning signs were visible, but ignored. Then Emma heard someone calling her name. "Emma." She turned. Rachel was running toward her. "What happened?" "Nothing bad." Rachel stopped and caught her breath. "You're needed in room 218. "Why?" "Because the new resident says the patient is fine, and the mother says something is wrong." Emma looked toward the room. She immediately understood. The story was repeating itself. Not the diagnosis. The situation. Someone was saying, "Everything is fine." Someone else was saying, "Something isn't." Emma walked into the room. A young girl was sitting on the bed. Her mother stood beside her. The resident looked irritated. "She's had a stomach bug for 2 days." Emma looked at the child. The girl was pale. Very pale. "What's her name?" "Amelia." Amelia. The girl looked at Emma, but did not respond. Emma looked at the mother. "What changed today?" The mother answered immediately. She stopped talking. The resident sighed. "She's tired." "She always talks," the mother said. Emma looked at the child. Then at the monitor. Then at the mother. "Has she been sleepy?" "Yes." "Vomiting?" "Twice." "Headache?" The mother nodded. "She said her head hurt this morning." Emma looked at the resident. He looked back. "I was told this was viral." Emma nodded. "It might be." The resident relaxed. "But let's make sure." His expression changed. Emma did not accuse him. She did not challenge his authority. She simply asked questions. That was the difference. A few minutes later, additional testing was ordered. The result was not as serious as Sophie's condition, but it revealed something that required treatment. Amelia had severe dehydration and an early electrolyte imbalance. The treatment was simple. Fluids. Monitoring. Observation. She improved quickly. The resident thanked Emma. "I almost sent her home." Emma shook her head. "You weren't wrong to think of a virus. But you listened when her mother said something had changed." The resident smiled. "Maybe I'm learning." Emma smiled back. "That's the job." That evening, Rachel found Emma at the nurse's station. "You realize what just happened, right?" Emma looked at her. "What?" "You changed the way he thought." Emma shook her head. "No." "Yes." "I asked questions." "That's exactly what changed it." Emma laughed. You're making too much of it. Rachel leaned against the desk. Maybe. She paused. But sometimes asking the right question is the biggest thing you can do. Emma looked down at the charts. She remembered Daniel. She remembered how badly she had wanted someone to ask one more question that night. One more question might not have changed the weather. It might not have fixed the helicopter. It might not have changed the outcome. But she still wondered. That was the cruel part of loss. The unanswered questions never completely disappeared. They simply became quieter. Later that night, Emma returned home. She opened her apartment door and found an envelope on the floor. There was no return address. She picked it up. Inside was a letter. The handwriting was familiar. It was from Thomas Hale. Emma read it slowly. He thanked her again. But this time he wrote something different. He said Sophie was recovering. She had started eating normally. She was demanding pancakes. She had also asked whether Emma could come to her birthday. Emma smiled. Then she reached the final paragraph. Thomas wrote that he had spent most of his career believing leadership meant having the answer. After what happened to Sophie, he realized something different. Leadership sometimes meant creating enough space for someone else to speak. Emma folded the letter. She placed it beside the drawing Sophie had given her. A little girl. A nurse. A dolphin. And beneath them, a crooked sentence written by a child. Thank you for listening. Emma stared at it. She realized that sentence meant more than the thank you itself. Listening had saved Sophie. Not technology. Not rank. Not reputation. Listening. Emma placed the drawing carefully into a drawer. Then her phone rang. It was Rachel. Are you awake? Emma laughed. It's 11 at night. That's not an answer. Yes. I have something to tell you. What? The hospital wants you to speak at next month's training session. Emma sighed. About Sophie? Partly. What else? About your approach to emergency assessment. Emma sat down. I don't think I'm ready. You've been saying that for weeks. Because it's true. Rachel laughed. Maybe being ready doesn't mean you know everything. Emma remembered her own words. You don't need to know exactly what is happening before you admit something isn't right. She smiled. Fine. Fine. I'll do it. Rachel cheered. Yes. But I'm not wearing a dress. I wasn't asking. And no introduction about my military background. Why? Because that's not what the lesson is about. Rachel became quiet. Then what is it about? Emma looked toward the drawer where Sophie's drawing was stored. About paying attention. The next month arrived quickly. Emma stood in front of a room filled with doctors, nurses, students, and medical staff. She felt nervous. She had faced gunfire. She had worked under impossible conditions. She had treated people while aircraft shook around her. But standing behind a podium in a hospital conference room somehow felt harder. A microphone sat in front of her. A projector displayed the first slide. There was no dramatic title. No photograph of her. No mention of medals. Just one question. What did we miss? The room became silent. Emma looked at the audience. That's the question I want you to ask yourselves whenever a patient doesn't improve the way you expected. She clicked to the next slide. Sophie's case wasn't missed because nobody cared. Another slide. It wasn't missed because nobody was intelligent. Another. It was missed because the first explanation became stronger than the new evidence. She paused. Once we decide what something is, we naturally begin looking for information that confirms it. Several people began taking notes. Emma continued. But patients don't care what diagnosis we chose yesterday. A few people smiled. Patients only give us what is happening today. She clicked again. That's why change matters. She explained how Sophie had gradually developed new symptoms. Fever. Vomiting. Headache. Sleepiness. Behavior changes. Pain behind the ear. A sluggish pupil. None of these findings alone screamed disaster. Together, they told a different story. Emma explained how bedside nurses often notice changes because they spent more continuous time with patients. A doctor might see someone for 10 minutes. A nurse might watch that same patient for several hours. That difference mattered. Your job isn't to know everything, Emma told the room. Your job is to notice when the story stops making sense. The room remained silent. She could tell they were listening. Then someone raised a hand. It was a senior physician. How do you know when to challenge someone more experienced? Emma smiled. You don't challenge the person. She paused. You challenge the information. The physician nodded. If the evidence changes, the conversation should change. Another person raised a hand. What if you're wrong? Emma looked at them. You will be. A few people laughed. You will absolutely be wrong sometimes. She smiled. I was wrong many times during my career. She became serious again. The goal isn't to be right every time. The goal is to make sure fear of being wrong doesn't stop you from speaking when something doesn't fit. That sentence became the most quoted line from her presentation. But Emma did not know that yet. After the session, several young nurses approached her. One was nervous. I've been afraid to speak up. Emma looked at her. Why? Because I'm new. Emma smiled. So was I. You didn't feel afraid? Of course I did. Then how did you do it? Emma thought about it. I was more afraid of being silent. The nurse nodded. Emma put a hand on her shoulder. Your voice doesn't have to be loud. It just has to be clear. The nurse smiled. Thank you. Emma watched her walk away. For a moment, she felt something she had not expected. Peace. Not complete peace. Daniel's memory was still there. The loss was still there. But it no longer felt like a punishment. It felt like a responsibility. A lesson she could carry forward. That night, she visited Sophie again. Sophie was sitting on a bench outside the hospital with Thomas. She was wearing a yellow jacket. Her hair had grown longer. The scar behind her ear was barely visible. When she saw Emma, she jumped up. Dolphin lady. Emma laughed. You came back. I told you I would. Sophie ran toward her. Thomas stood behind her, smiling. She's been waiting for you. Emma crouched down. How are you feeling? Good. Head still hurts. No. Sleeping. Yes. Any vomiting? Sophie looked offended. No. Emma smiled. Good. Sophie reached into her backpack. I made something. She pulled out a small paper dolphin. Emma looked at it. It's beautiful. It's for you. Emma took it carefully. Thank you. Sophie whispered something. What? I want to be a doctor. Emma smiled. Why? Because doctors save people. Thomas laughed. Emma looked at Sophie. Nurses save people too. Sophie thought about that. Then I'll be both. Emma laughed. That's a good plan. Thomas looked at Emma. You've changed her. Emma shook her head. No. Yes. I just listened. Thomas smiled. Sometimes that's enough. Emma looked at the little girl. Sophie was alive. She was laughing. She was planning her future. And somewhere inside Emma, something finally changed. For years, she had believed the most important moment in a rescue was the moment you arrived. Now she understood it could be the moment before. The moment someone noticed. The moment someone questioned. The moment someone refused to accept the easy answer. That was where the rescue really began. A few months later, Dr. Mercer changed the department's morning routine. Every pediatric case began with one simple question. What changed? Not what is the diagnosis. Not what did the last doctor say. Not what does the chart call it. What changed? It forced everyone to look at the patient again. And it worked. Not perfectly. No system worked perfectly. But mistakes became easier to catch. Nurses spoke more confidently. Residents asked better questions. Doctors began listening differently. Emma noticed the difference during one particularly busy shift. A young nurse approached her. I think something is wrong with room 223. Emma looked up. What? I'm not sure. That's okay. The patient came in with pneumonia, but his breathing pattern has changed. Emma stood. Show me. The two nurses walked together. Emma smiled quietly. Not because she knew what was wrong. She didn't. But because the young nurse had noticed. She had spoken. And that was the real victory. Not one nurse becoming famous. Not one doctor being embarrassed. Not one dramatic rescue. The real victory was creating a place where the next person did not have to fight so hard to be heard. That was how Sophie changed the hospital. And that was how Emma slowly changed too. She no longer saw herself as a former military rescuer trying to become someone else. She was Emma Carter, a nurse, a former rescue specialist, a woman who had survived loss, a person who had learned to listen, and someone who understood that courage did not always look like running toward danger. Sometimes courage looked like raising your hand in a crowded room. Sometimes it looked like saying, "I don't think this fits." Sometimes it looked like asking one more question. And sometimes, it looked like a quiet nurse standing beside a frightened child and refusing to leave until someone finally understood what she had been trying to say. If you believe quiet courage can change someone's life, leave a like, subscribe for more emotional stories, and share this story with a friend who needs to hear that speaking up can matter more than having the loudest voice in the room. The story of Sophie eventually became less about the frightening night in the hospital and more about everything that happened afterward. The hospital changed its procedures. The nurses became more confident. The doctors became more willing to listen. And Emma became something she had never planned to become. A mentor. Not because she had all the answers, but because she had learned how dangerous it was to believe that anyone did. One evening, months after Sophie's surgery, Emma was finishing her shift when she noticed something taped to the inside of her locker. It was the little dolphin Sophie had drawn. The paper had become slightly worn. The edges were bent. But Emma kept it there. Underneath it was another piece of paper. A photograph. It showed Emma and Sophie standing together outside the hospital. Sophie was smiling. Emma was smiling. Thomas stood behind them. On the back, Thomas had written, "Some heroes wear uniforms. Some wear scrubs. The best ones never need to tell you which." Emma read the sentence several times. Then she closed the locker. She walked back into the pediatric hallway. A call bell sounded. A child cried. A nurse called for help. Emma moved toward the room. No cámaras. No reporters. No aplausos. Just another patient. Another family. Another chance to listen. And that was exactly where she wanted to be. The meeting ended, but the lesson did not. Long after the doctors had left the conference room, Emma Carter remained in her chair, staring at the final image on the screen. It was the scan that had changed everything. A small dark area behind Sophie's ear. A place that had been there before anyone noticed it. A place that had been silently growing while everyone around the little girl believed they already knew what was wrong. Emma looked at the image one last time before standing. She knew something important had happened that day, but she also knew the hospital would not change because of one meeting. Real change took time. It required people to remember what they had learned when the next difficult patient arrived. As Emma walked back toward the pediatric floor, she passed Dr. Mercer. He stopped. "Emma." She turned. "Yes. I wanted to ask you something." "What?" "When you first noticed something was wrong with Sophie, were you completely certain?" Emma smiled faintly. "No." Mercer looked surprised. "You weren't?" "No." "Then why did you keep pushing?" Emma thought for a moment. "Because I was more certain that something didn't fit than I was certain about what the diagnosis was." Mercer remained quiet. Emma continued. "That's the difference." "What difference?" "You don't always need to know exactly what is happening before you admit that something isn't right." Mercer slowly nodded. That sentence stayed with him. It stayed with Emma too, because it was one of the most important lessons she had learned in both of her lives. You could be uncertain about the answer and still be certain that another question needed to be asked. That afternoon, Emma returned to the pediatric floor. The department was busy again. A toddler was crying. A father was arguing with a registration clerk. A monitor was beeping in one of the rooms. A resident was running down the hallway with a stack of papers. It looked like every other day. But Emma knew it wasn't. She had begun to notice small changes. Nurses were talking more. Doctors were asking more questions. Residents were spending longer at the bedside. Nobody wanted another Sophie. Nobody wanted another patient whose warning signs were visible, but ignored. Then Emma heard someone calling her name. Emma. She turned. Rachel was running toward her. What happened? Nothing bad. Rachel stopped and caught her breath. You're needed in room 218. Why? Because the new resident says the patient is fine, and the mother says something is wrong. Emma looked toward the room. She immediately understood. The story was repeating itself. Not the diagnosis. The situation. Someone was saying, everything is fine. Someone else was saying, something isn't. Emma walked into the room. A young girl was sitting on the bed. Her mother stood beside her. The resident looked irritated. She's had a stomach bug for 2 days. Emma looked at the child. The girl was pale. Very pale. What's her name? Amelia. Amelia. The girl looked at Emma, but did not respond. Emma looked at the mother. What changed today? The mother answered immediately. She stopped talking. The resident sighed. She's tired. She always talks, the mother said. Emma looked at the child. Then at the monitor. Then at the mother. Has she been sleepy? Yes. Vomiting? Twice. Headache? The mother nodded. She said her head hurt this morning. Emma looked at the resident. He looked back. I was told this was viral. Emma nodded. It might be. The resident relaxed. But let's make sure. His expression changed. Emma did not accuse him. She did not challenge his authority. She simply asked questions. That was the difference. A few minutes later, additional testing was ordered. The result was not as serious as Sophie's condition, but it revealed something that required treatment. Amelia had severe dehydration and an early electrolyte imbalance. The treatment was simple. Fluids. Monitoring. Observation. She improved quickly. The resident thanked Emma. I almost sent her home. Emma shook her head. You weren't wrong to think of a virus. But you listened when her mother said something had changed. The resident smiled. Maybe I'm learning. Emma smiled back. That's the job. That evening, Rachel found Emma at the nurse's station. You realize what just happened, right? Emma looked at her. What? You changed the way he thought. Emma shook her head. No. Yes. I asked questions. That's exactly what changed it. Emma laughed. You're making too much of it. Rachel leaned against the desk. Maybe. She paused. But sometimes asking the right question is the biggest thing you can do. Emma looked down at the charts. She remembered Daniel. She remembered how badly she had wanted someone to ask one more question that night. One more question might not have changed the weather. It might not have fixed the helicopter. It might not have changed the outcome. But she still wondered. That was the cruel part of loss. The unanswered questions never completely disappeared. They simply became quieter. Later that night, Emma returned home. She opened her apartment door and found an envelope on the floor. There was no return address. She picked it up. Inside was a letter. The handwriting was familiar. It was from Thomas Hale. Emma read it slowly. He thanked her again. But this time he wrote something different. He said Sophie was recovering. She had started eating normally. She was demanding pancakes. She had also asked whether Emma could come to her birthday. Emma smiled. Then she reached the final paragraph. Thomas wrote that he had spent most of his career believing leadership meant having the answer. After what happened to Sophie, he realized something different. Leadership sometimes meant creating enough space for someone else to speak. Emma folded the letter. She placed it beside the drawing Sophie had given her. A little girl. A nurse. A dolphin. And beneath them, a crooked sentence written by a child. Thank you for listening. Emma stared at it. She realized that sentence meant more than the thank you itself. Listening had saved Sophie. Not technology. Not rank. Not reputation. Listening. Emma placed the drawing carefully into a drawer. Then her phone rang. It was Rachel. Are you awake? Emma laughed. It's 11 at night. That's not an answer. Yes. I have something to tell you. What? The hospital wants you to speak at next month's training session. Emma sighed. About Sophie? Partly. What else? About your approach to emergency assessment. Emma sat down. I don't think I'm ready. You've been saying that for weeks. Because it's true. Rachel laughed. Maybe being ready doesn't mean you know everything. Emma remembered her own words. You don't need to know exactly what is happening before you admit something isn't right. She smiled. Fine. Fine. I'll do it. Rachel cheered. Yes. But I'm not wearing a dress. I wasn't asking. And no introduction about my military background. Why? Because that's not what the lesson is about. Rachel became quiet. Then what is it about? Emma looked toward the drawer where Sophie's drawing was stored. About paying attention. The next month arrived quickly. Emma stood in front of a room filled with doctors, nurses, students, and medical staff. She felt nervous. She had faced gunfire. She had worked under impossible conditions. She had treated people while aircraft shook around her. But standing behind a podium in a hospital conference room somehow felt harder. A microphone sat in front of her. A projector displayed the first slide. There was no dramatic title. No photograph of her. No mention of medals. Just one question. What did we miss? The room became silent. Emma looked at the audience. That's the question I want you to ask yourselves whenever a patient doesn't improve the way you expected. She clicked to the next slide. Sophie's case wasn't missed because nobody cared. Another slide. It wasn't missed because nobody was intelligent. Another. It was missed because the first explanation became stronger than the new evidence. She paused. Once we decide what something is, we naturally begin looking for information that confirms it. Several people began taking notes. Emma continued. But patients don't care what diagnosis we chose yesterday. A few people smiled. Patients only give us what is happening today. She clicked again. That's why change matters. She explained how Sophie had gradually developed new symptoms. Fever, vomiting, headache, sleepiness, behavior changes, pain behind the ear, a sluggish pupil. None of these findings alone screamed disaster. Together, they told a different story. Emma explained how bedside nurses often notice changes because they spent more continuous time with patients. A doctor might see someone for 10 minutes. A nurse might watch that same patient for several hours. That difference mattered. Your job isn't to know everything, Emma told the room. Your job is to notice when the story stops making sense. The room remained silent. She could tell they were listening. Then someone raised a hand. It was a senior physician. How do you know when to challenge someone more experienced? Emma smiled. You don't challenge the person. She paused. You challenge the information. The physician nodded. If the evidence changes, the conversation should change. Another person raised a hand. What if you're wrong? Emma looked at them. You will be. A few people laughed. You will absolutely be wrong sometimes. She smiled. I was wrong many times during my career. She became serious again. The goal isn't to be right every time. The goal is to make sure fear of being wrong doesn't stop you from speaking when something doesn't fit. That sentence became the most quoted line from her presentation. But Emma did not know that yet. After the session, several young nurses approached her. One was nervous. I've been afraid to speak up. Emma looked at her. Why? Because I'm new. Emma smiled. So was I. You didn't feel afraid? Of course I did. Then how did you do it? Emma thought about it. I was more afraid of being silent. The nurse nodded. Emma put a hand on her shoulder. Your voice doesn't have to be loud. It just has to be clear. The nurse smiled. Thank you. Emma watched her walk away. For a moment, she felt something she had not expected. Peace. Not complete peace. Daniel's memory was still there. The loss was still there. But it no longer felt like a punishment. It felt like a responsibility. A lesson she could carry forward. That night, she visited Sophie again. Sophie was sitting on a bench outside the hospital with Thomas. She was wearing a yellow jacket. Her hair had grown longer. The scar behind her ear was barely visible. When she saw Emma, she jumped up. Dolphin lady. Emma laughed. You came back. I told you I would. Sophie ran toward her. Thomas stood behind her, smiling. She's been waiting for you. Emma crouched down. How are you feeling? Good. Head still hurts. No. Sleeping. Yes. Any vomiting? Sophie looked offended. No. Emma smiled. Good. Sophie reached into her backpack. I made something. She pulled out a small paper dolphin. Emma looked at it. It's beautiful. It's for you. Emma took it carefully. Thank you. Sophie whispered something. What? I want to be a doctor. Emma smiled. Why? Because doctors save people. Thomas laughed. Emma looked at Sophie. Nurses save people too. Sophie thought about that. Then I'll be both. Emma laughed. That's a good plan. Thomas looked at Emma. You've changed her. Emma shook her head. No. Yes. I just listened. Thomas smiled. Sometimes that's enough. Emma looked at the little girl. Sophie was alive. She was laughing. She was planning her future. And somewhere inside Emma, something finally changed. For years, she had believed the most important moment in a rescue was the moment you arrived. Now she understood it could be the moment before. The moment someone noticed. The moment someone questioned. The moment someone refused to accept the easy answer. That was where the rescue really began. A few months later, Dr. Mercer changed the department's morning routine. Every pediatric case began with one simple question. What changed? Not, what is the diagnosis? Not, what did the last doctor say? Not, what does the chart call it? What changed? It forced everyone to look at the patient again. And it worked. Not perfectly. No system worked perfectly. But mistakes became easier to catch. Nurses spoke more confidently. Residents asked better questions. Doctors began listening differently. Emma noticed the difference during one particularly busy shift. A young nurse approached her. I think something is wrong with room 223. Emma looked up. What? I'm not sure. That's okay. The patient came in with pneumonia, but his breathing pattern has changed. Emma stood. Show me. The two nurses walked together. Emma smiled quietly. Not because she knew what was wrong. She didn't. But because the young nurse had noticed. She had spoken. And that was the real victory. Not one nurse becoming famous. Not one doctor being embarrassed. Not one dramatic rescue. The real victory was creating a place where the next person did not have to fight so hard to be heard. That was how Sophie changed the hospital. And that was how Emma slowly changed too. She no longer saw herself as a former military rescuer trying to become someone else. She was Emma Carter, a nurse, a former rescue specialist, a woman who had survived loss, a person who had learned to listen, and someone who understood that courage did not always look like running toward danger. Sometimes courage looked like raising your hand in a crowded room. Sometimes it looked like saying, I don't think this fits. Sometimes it looked like asking one more question. And sometimes, it looked like a quiet nurse standing beside a frightened child and refusing to leave until someone finally understood what she had been trying to say. If you believe quiet courage can change someone's life, leave a like, subscribe for more emotional stories, and share this story with a friend who needs to hear that speaking up can matter more than having the loudest voice in the room. The story of Sophie eventually became less about the frightening night in the hospital and more about everything that happened afterward. The hospital changed its procedures. The nurses became more confident. The doctors became more willing to listen. And Emma became something she had never planned to become. A mentor. Not because she had all the answers, but because she had learned how dangerous it was to believe that anyone did. One evening, months after Sophie's surgery, Emma was finishing her shift when she noticed something taped to the inside of her locker. It was the little dolphin Sophie had drawn. The paper had become slightly worn. The edges were bent. But Emma kept it there. Underneath it was another piece of paper. A photograph. It showed Emma and Sophie standing together outside the hospital. Sophie was smiling. Emma was smiling. Thomas stood behind them. On the back, Thomas had written, Some heroes wear uniforms. Some wear scrubs. The best ones never need to tell you which. Emma read the sentence several times. Then she closed the locker. She walked back into the pediatric hallway. A call bell sounded. A child cried. A nurse called for help. Emma moved toward the room. No cámaras. No reporters. No applause. Just another patient. Another family. Another chance to listen. And that was exactly where she wanted to be. Sometimes the most important moment in a person's life arrives quietly. There is no warning bell. No dramatic music. No crowd gathering around. Sometimes it is only a question. Sometimes it is only a look. Sometimes it is one person noticing that something does not feel right when everyone else has already decided that everything is fine. For Emma Carter, that lesson had become part of who she was. She no longer thought of herself as the nurse who had challenged a room full of doctors. She thought of herself as someone who had learned to pay attention. That difference mattered. Because if she had started believing that she was special, she might have stopped listening to other people. Instead, she became more curious, more careful, more willing to admit when she did not know something. That was why the younger nurses trusted her. They could walk into her office and say, "I think something is wrong." Emma never laughed. She never said, "You're only new." She would simply look up and ask, "What did you notice?" That question became famous on the pediatric floor. What did you notice? Not what did the chart say? Not what did the previous doctor say? Not what do you think the diagnosis is? What did you notice? It was a simple question, but it changed the way people worked. One afternoon, a young nurse named Olivia stood outside Emma's office. She knocked softly. "Come in." Olivia stepped inside holding a tablet. "I need your opinion." Emma looked up. "Tell me." "I have a patient in room 318. "What's happening?" 6-year-old boy. Fever. Cough. Doctor thinks it's viral." Emma waited. Olivia looked nervous. But I don't like how he looks." Emma put down her pen. "Tell me what you mean by that." "I don't know how to explain it." "Try." Olivia took a breath. "He's too quiet." Emma nodded. "How quiet?" "He doesn't complain. He doesn't cry. His mother says he's normally very active." "Vitals?" "Mostly normal." "Mostly." "Heart rate is slightly high." "Respiratory rate?" "Also slightly high." "Blood pressure?" "Normal." "Oxygen?" "Normal." Emma stood. "Let's see him." They walked together. Inside room 318, a little boy lay under a blanket. His mother sat beside him. Emma introduced herself. She spoke to the child. The boy opened his eyes. "Hello." His voice was weak. Emma smiled. "What's your favorite food?" The boy thought. "Pizza." "What kind?" "Cheese." Emma smiled. "Good answer." She looked at Olivia. Olivia had already started checking the monitor. Emma watched the child breathe. 1 breath. 2. 3. There was something subtle. The right side of his chest moved slightly less than the left. Emma placed her hand gently against his back. She listened. The breath sounds were reduced on one side. She looked at Olivia. "Call the doctor." The physician arrived. A chest X-ray was ordered. The result showed pneumonia with a developing complication. Treatment began immediately. The child's mother cried. Not because the diagnosis was good, but because they had caught it before it became worse. Afterward, Olivia found Emma in the hallway. "You knew." Emma shook her head. "No. But you noticed." "Yes." Olivia smiled. "What's the difference?" Emma looked at her. "The difference is that knowing comes after you check." Olivia nodded. Emma continued walking. "Never be afraid to say you don't know. Be afraid of pretending you do." That sentence stayed with Olivia. It stayed with dozens of other nurses. And slowly, the culture of the department changed. Doctors began asking nurses questions before entering rooms. Nurses became more confident about speaking. Families became more comfortable explaining unusual symptoms. And patients benefited. The hospital did not become perfect. No hospital could. But people became less afraid of being wrong. That was important. Because fear of being wrong could become more dangerous than ignorance. If you were wrong, you could correct yourself. But if you were too afraid to speak, nobody got the chance to correct anything. Emma knew that better than anyone. One evening, she received an unexpected message from Thomas Hale. "Are you free?" She replied. "For 5 minutes." His answer came immediately. "I need 10. Emma smiled. That's how commanders negotiate. He called. "How is Sophie?" "Busy." "Doing what?" "Apparently she's decided she wants to become a veterinarian." Thomas laughed. "Good." "Why?" "Because she's already practicing." "On you?" "Mostly." Emma laughed. Thomas became quiet. "There's something else." "What?" "I've been asked to speak at a medical leadership conference." "Congratulations. They want me to talk about decision-making under pressure." Emma smiled. "You'll be excellent. I want you there." Emma paused. "Why?" "Because I don't want to tell the story without the person who taught me the lesson." Emma looked down at her desk. "I don't like speaking in public." "I know. I really don't." "I know. Then why ask?" "Because you don't need to give a speech." "What do I need to do?" "Tell the truth." Emma was silent. Thomas continued. "People in leadership need to hear what happens when the wrong person becomes the loudest voice in the room." Emma thought about it. "I'll think about it." "That's enough." The conference was 6 weeks later. Emma almost canceled. She stood backstage with her hands clasped tightly. Hundreds of medical professionals sat beyond the curtain. Doctors, nurses, administrators, military medical officers, students. Emma could hear the presenter introducing Thomas. Then came her name. Her stomach tightened. She walked onto the stage. Thomas stood beside the podium. He looked at her and smiled. Emma looked at the audience. She expected fear. Instead, she remembered a little girl in a pink shirt. She remembered a pen light. She remembered the words. "Look again." Thomas introduced her. "This is Emma Carter." The audience applauded. Emma waited. Then she spoke. "I don't want to tell you a story about a hero." The room became quiet. "I want to tell you about a mistake." People leaned forward. "Because the most important thing that happened that day was not that I was right." She paused. "The important thing was that eventually, people listened." She explained what happened. She talked about the child, the symptoms, the missed clues, the hesitation. She did not insult the doctors. She did not make herself sound perfect. She explained that she had also been afraid. "I knew something was wrong," she said. "But I was still afraid that I was wrong." She looked across the room. That feeling never completely disappears. A few people nodded. "The goal isn't to become fearless." She paused. "The goal is to become responsible enough to speak even while you're afraid." The audience was silent. Emma continued. "Medicine is a team sport. Nobody sees everything. Nobody knows everything. And the person with the lowest title in the room may notice the highest risk detail." That line received the strongest reaction. But Emma did not stop. "Your job is not to protect your ego. Your job is to protect the patient." The room remained quiet. Then she told them about Daniel. Not every detail. Just enough. She explained that loss had shaped her. She explained that she had once believed leaving the military meant leaving behind the part of herself that mattered. But she had learned something. You don't have to return to the battlefield to use what the battlefield taught you. That sentence stayed with the audience. Emma finished with one final thought. When someone speaks up, don't ask first what their title is. Ask what they saw. The applause began slowly. Then it grew. Emma looked toward Thomas. He was standing. So was almost everyone else. She smiled. But the moment that mattered happened later. A young doctor approached her backstage. "I needed to hear that." Emma smiled. "Why?" "Because yesterday, a nurse told me something about a patient." "What did you do?" "I dismissed her." Emma waited. "I went back." "Good." "I found out she was right." Emma smiled. "Then you learned the lesson." The doctor nodded. "I want to be better." "You already started." The doctor walked away. Emma watched her disappear into the crowd. She realized something. The story had become bigger than her. That was okay. Stories were supposed to travel. Lessons were supposed to spread. and courage was supposed to be shared. When Emma returned home that night, she placed the conference badge beside the paper dolphin. She looked at both. One represented the professional she had become. The other represented the child who had changed her. She thought about how strange life was. A person could spend years trying to escape a memory, only to discover that the memory was pointing toward their purpose. Daniel had not been saved. That would never change. Emma could not rewrite that night, but she could decide what his death would mean. She could allow it to become only a painful memory, or she could let it teach her. She chose the second, and that choice changed hundreds of lives, maybe thousands, because every nurse she taught would eventually care for another patient. Every doctor who learned to listen would influence another team. Every student who heard the story would carry the lesson somewhere else. That was how change happened. Quietly, person by person, room by room, shift by shift. The following year, Coastal Valley Hospital created a new training program. It was called the Second Look Initiative. The name was simple. The idea was even simpler. Before finalizing a difficult diagnosis, teams were encouraged to ask, "What are we missing? What changed? What does the bedside team notice? What does the family notice? What does the patient notice?" It did not replace medical judgment. It strengthened it. Emma was asked to help design the program. She agreed. For months, she worked with doctors, nurses, administrators, and patient advocates. They created simulations. They recreated difficult cases. They deliberately included misleading information. They taught teams how easily people could become anchored to an early diagnosis. They taught them how authority could silence uncertainty. And they taught them how to disagree without becoming enemies. Emma insisted on one rule. Nobody was punished for raising a reasonable concern. That rule became the heart of the program. One morning, a group of medical students attended Emma's training. She placed a case file on the table. "Read it." They did. A patient had fever, pain, fatigue, abnormal laboratory results. One student immediately suggested an infection. Another agreed. Emma nodded. "Good." She waited. "Now forget the diagnosis." They looked confused. "Forget what?" "The diagnosis." She pointed at the case. "Start again." They read the symptoms. One student noticed something. "There's a detail about the pain." "Which detail?" "It gets worse at a specific time." Emma nodded. What could that mean? The discussion began. The students debated. Nobody was immediately certain. That was exactly what Emma wanted. At the end, she said, "Your first answer isn't your enemy. Your attachment to your first answer is." The students wrote it down. Emma smiled. Another lesson had been passed forward. Months turned into years. Sophie grew older. She still visited the hospital. Eventually, she became old enough to understand what had happened. One afternoon, when she was 12, she sat with Emma in the hospital cafeteria. "Grandpa told me I almost died." Emma nodded. "You were very sick. Was it really that bad?" Emma thought carefully. "Yes." Sophie looked down. "Did you know?" "I knew something was wrong." "How?" "You told me." "I did. You told me your head hurt." Sophie smiled. "I probably complained a lot." Emma laughed. "You did." Sophie became quiet. "Did you save me?" Emma shook her head. "A lot of people saved you." "Who?" "The doctors. The nurses. Your family. And you." Emma smiled. "I was one piece of the team." Sophie considered that. Then she asked, "Why did everyone listen to you?" Emma laughed. "They didn't." Sophie looked surprised. "They didn't." "No." "Then how did you save me?" Emma looked into her eyes. "Because I kept asking." Sophie nodded slowly. Then she smiled. "I think I'll do that too." Emma smiled back. "Good." That afternoon, Sophie left the hospital carrying a new stuffed dolphin. Emma watched her walk away with her grandfather. She felt something she had not expected. Peace. Not complete peace. Daniel's memory would always hurt. But it no longer felt like a wound. It felt like a scar. Something that had happened. Something that had changed her. something she could touch without bleeding. Emma returned to the nurse's station. A new nurse was standing there. "Excuse me." Emma turned. "Yes. I've heard about you." Emma smiled. "That's dangerous." The nurse laughed. "I'm new. I know." "How?" "You're holding your badge upside down." The nurse looked down. Emma laughed. "Don't worry. Everyone does it." The nurse smiled nervously. "I wanted to ask you something." "Go ahead." "How do I know when I should speak up?" Emma looked at her. Then she asked the question she had asked hundreds of people before. "What did you notice?" The young nurse took a breath and began explaining. Emma listened. She did not interrupt. She did not judge. She did not assume. She listened. Because that was where everything had started. Not with a medal. Not with a rank. Not with a dramatic rescue. It had started with someone willing to listen to a young nurse who was afraid she might be wrong. And perhaps that was the greatest lesson of all. The world often celebrates the person who acts. But before action comes attention. Before attention comes listening. And before listening comes humility. The humility to admit that you might not know everything. The humility to let another person finish speaking. The humility to look again. Emma Carter had learned that lesson in the hardest way possible. But she spent the rest of her career making sure other people did not have to. So when someone asks what happened to the rookie nurse who once challenged an entire room of experienced doctors, the answer is simple. She became a teacher. She became a mentor. She became a better nurse. But most importantly, she became someone who never forgot how dangerous silence could be. And every time a young nurse raised a hand in a crowded room, Emma remembered the little girl behind the hospital doors. She remembered the pain, the fear, the confusion, and the moment everything changed because someone finally looked closer. The lesson was never that doctors were bad. It was never that nurses were always right. It was never about proving one profession better than another. It was about teamwork. It was about humility. It was about understanding that a patient is not a chart. A patient is a person. And sometimes the person standing closest to that patient sees something that no test has shown yet. That observation deserves attention. It deserves respect. It deserves a second look. And sometimes, that second look saves a life. If you believe every patient deserves to be heard and every quiet voice deserves a chance to speak, support this story with a like, subscribe to the channel, and share it with someone who works hard behind the scenes. Your support helps more stories about courage, compassion, and unseen heroes reach people who need them. Emma kept working. The hospital kept changing. And the story kept traveling. Somewhere, another young nurse was probably standing at another nurse's station. She was probably nervous. Probably wondering whether to speak. Probably thinking about the senior doctors around her. And maybe she would remember Emma's lesson. Maybe she would raise her hand. Maybe someone would listen. Maybe a patient would get help sooner. And maybe that was enough. Because heroes do not always walk into a room wearing uniforms covered in medals. Sometimes they wear ordinary scrubs. Sometimes they carry a clipboard. Sometimes they are exhausted. Sometimes they are only 4 months into the job. And sometimes they are standing quietly in the corner, waiting for someone to ask the most important question. What did you notice? That question had once changed Emma's life. Now it was changing everyone around her. And the little paper dolphin remained on her desk. Not as a trophy. Not as proof that she had been right. But as a reminder that every patient deserves another look. Every voice deserves to be heard. And every person who cares enough to speak should know that their courage matters. Emma had once believed that her greatest contribution would come from the life she had left behind. She was wrong. Her greatest contribution was still being written. One patient at a time. One nurse at a time. One question at a time. And one quiet act of courage after another. What if the person who saves a life is not the person everyone is watching, but the person standing quietly in the corner, noticing what everyone else has missed? That question stayed with Emma Carter for years, because she had learned that important moments rarely announce themselves. Sometimes they looked like an ordinary hospital shift, an ordinary patient, and an ordinary question that nobody else thought to ask. If stories about quiet courage mean something to you, take a second to like this video, subscribe to the channel, and share it with someone who believes that one small act of courage can change an entire life. Emma had become known throughout Coastal Valley Hospital for one simple habit. She looked twice. If a patient said something unusual, she listened. If a monitor showed a small change, she checked it again. If a family member said, "Something is different," she never brushed it aside. And if a younger nurse approached her with uncertainty, Emma never asked, "Why are you worried?" She asked, "What did you notice?" That question had become almost like a signature. People joked about it. Some nurses called it the Carter question. But Emma never treated it as a joke. She knew how much could be hidden inside a small observation. She also knew how dangerous it could be when people became too comfortable with the first explanation. One morning, Emma arrived early for her shift. The hospital was unusually quiet. The night team was finishing their reports. A few lights in the hallway were still dimmed. A cleaning worker pushed a cart past the nurse's station. Emma placed her coffee beside the computer and opened the overnight reports. Everything looked normal. Then she noticed one patient's name. Room 226. A 9-year-old boy named Noah Bennett. She read the notes. Mild fever. Stomach pain. Nausea. Possible stomach virus. She continued reading. Then she stopped. The boy had been brought in twice during the previous week. Both times he had been discharged. Emma opened the older notes. Same complaint. Stomach pain. Nausea. Fatigue. No clear diagnosis. She looked at the newest note. The pain had moved. Yesterday it had been near the center of his stomach. This morning, it was on the right side. Emma leaned back. She did not want to assume. She wanted more information. She walked toward room 226. Noah was sitting upright in bed. His mother was beside him. "Good morning." Noah looked at her. "Morning." Emma smiled. "How are you feeling?" "Better." His mother looked surprised. "He's been saying that for 20 minutes. Emma looked at Noah. "Where does it hurt?" He pointed toward his lower right abdomen. Emma nodded. "When did it move there?" "Last night." "Did it hurt anywhere else before?" "Here." He touched the center of his stomach. "Did you eat dinner?" "No." "Why?" "I wasn't hungry." Emma looked at his mother. "Has he been drinking?" "Not much." Emma checked his vital signs. His heart rate was higher than expected. Not dangerously high. Just high enough to make Emma pause. She looked at his face. He looked tired. Very tired. "Does it hurt when you move?" Noah nodded. "Does it hurt when you cough?" Another nod. Emma stepped outside. The physician arrived a few minutes later. Emma gave the report. He has had repeated visits, pain that migrated to the lower right abdomen, reduced appetite, increasing heart rate, and pain with movement. The doctor listened. Then he said, "Appendicitis? That's what I'm wondering. I'll examine him." Emma nodded. The doctor entered the room. The examination confirmed the concern. An ultrasound was ordered. The result came back positive. Noah had appendicitis. He was taken for surgery later that morning. His mother thanked Emma. Emma shook her head. Thanked the whole team. But as she walked away, she thought about how easily it could have been missed. Again. Not because the doctors were careless. Not because anyone was intentionally ignoring him. Because common illnesses were common. And sometimes the dangerous condition was hiding behind the ordinary one. That was the problem. People did not miss rare diseases because they were stupid. They missed them because humans naturally looked for familiar explanations. Emma understood that now. Her job was not to assume the worst. Her job was to remain open to the possibility that the first answer might not be the final answer. Later that afternoon, Olivia came to her. "Can I ask you something?" "Of course." "Do you ever get tired of being the person who keeps questioning things?" Emma laughed. "Every day." Olivia smiled. "Then why keep doing it?" "Because being tired is temporary." Emma looked toward the patient rooms. "But regret can stay with you." Olivia became quiet. Emma continued. "I don't question everything because I think I'm smarter than everyone else. I question things because patients are complicated. People don't always read the textbook." Sometimes the textbook describes the average patient. But real patients aren't averages. Olivia nodded. That was another lesson. A diagnosis could be correct in general, and still be wrong for one person. Emma had learned that through Sophie. But she had learned something else too. Speaking up did not mean fighting. It did not mean humiliating someone. It did not mean proving that a doctor was wrong. It meant adding information to the conversation. Sometimes the person who speaks up is correct. Sometimes they are not. Both outcomes are acceptable if the patient benefits from the conversation. That idea changed Emma's relationship with the doctors around her. Dr. Mercer became one of her strongest supporters. He started asking nurses for input during rounds. He would stand outside a patient's room and say, "What's the bedside team seeing?" It became normal. Nobody thought it was strange anymore. And when a nurse disagreed, he listened. Sometimes he changed the plan. Sometimes he explained why he did not. But the nurse knew she had been heard. That alone changed everything. Dr. Rahman also became part of the effort. She created a monthly meeting where nurses and doctors reviewed difficult cases. Not to blame anyone. Not to punish anyone. To learn. They discussed cases where a small clue had been missed. They discussed cases where a nurse had noticed something before the physician. They discussed cases where the nurse had been wrong, but had still raised a reasonable concern. Emma insisted on that last part. If we only celebrate people who were right, she told them, we teach everyone else to stay silent. The room went quiet. She continued, we need to make speaking up safe. That sentence became the foundation of the program. Months later, the hospital received a letter from a patient's family. The patient was a teenage girl named Ava. She had been admitted with headaches. At first, the symptoms appeared ordinary. Stress, lack of sleep, possible migraine. But her mother insisted that something was different. A nurse listened. She noticed that Ava had started holding her head at an unusual angle. The nurse asked another question. A neurological examination was ordered. A serious problem was discovered early. Ava recovered. Her mother later wrote, I don't know the nurse's name. But she asked one more question. That question changed our daughter's life. Emma read the letter. She smiled. That was the goal. Not recognition. Not awards. Not headlines. Just fewer families receiving the phone call nobody wants. Just more children going home. Just more parents being able to watch their children grow up. That was enough. One evening, Emma was finishing her shift when she saw a familiar figure walking down the hallway. Thomas Hale. He was carrying a small box. Emma raised an eyebrow. What's that? Something for you. Should I be worried? Probably. He handed her the box. She opened it. Inside was a framed photograph. It showed Sophie standing beside a hospital sign. She was smiling. Beside her was Thomas. And beside him was Emma. The picture had been taken months earlier. Emma remembered the day. Sophie had insisted that everyone stand together. She had held the stuffed dolphin. Thomas had looked proud. Emma had tried not to cry. Now the photograph was framed. There was a small inscription underneath. For the person who taught us all to look again. Emma stared at it. I can't accept this. Why? Because I didn't do this alone. I know. Then it should belong to the hospital. Thomas smiled. That's why there's another one. He pulled out a second frame. This one contained a group photograph. Nurses, doctors, technicians, residents, everyone who had participated in the new training program. Emma laughed. You planned this? Of course. You're impossible. I've been told. She looked at the photograph. For a moment, she saw something she had never noticed before. Everyone was standing together. Nobody was in the center. There was no single hero. No single name. No single person receiving all the credit. That was exactly right. Because the real lesson had never been about one person. It was about a team learning to listen. Emma placed the photograph in her office. She kept the paper dolphin beside it. One represented the patient. The other represented the people who had learned from the patient. Together, they told the whole story. A story about mistakes. A story about courage. A story about humility. A story about what happens when people stop trying to prove who is right and start trying to discover what is true. Years passed. Emma became a senior nurse, then a clinical educator, then one of the hospital's most respected mentors. She still worked at the bedside. She refused to completely leave patient care. She wanted to remember why the work mattered. Every morning, she walked through the same hospital doors. Every morning, she saw new faces. Students, residents, new nurses, families. Some people recognized her. Most did not. Emma preferred it that way. She did not want her reputation to become a shield. She wanted people to judge her by what she did that day. One afternoon, a young doctor came into her office. He looked exhausted. "Can I talk to you?" "Sure." He sat down. "I made a mistake." Emma listened. "I ordered the wrong test." "Did the patient get hurt?" "No." "Then what happened?" "I caught it before anything happened." Emma nodded. "Then you learned something." "But I'm scared." "Good." The doctor looked confused. "Good. Fear can remind you to pay attention." She leaned forward. "But don't let it turn into shame." "What's the difference?" "Shame tells you that you are a bad doctor. Learning tells you that you made a bad decision." He nodded. "You can fix a decision." Emma smiled. "Exactly." He looked relieved. "How do I stop making mistakes?" Emma laughed softly. "You don't." He stared at her. "That's your advice?" "My advice is to build a system that catches mistakes before they hurt someone." She pointed toward the door. "And surround yourself with people who aren't afraid to tell you when you're wrong." The doctor smiled. "You're serious?" "Very." He stood. "Thank you." Emma nodded. As he left, she looked at the paper dolphin. She thought about how much had changed. But the core lesson remained. Nobody was perfect. The safest team was not the team that believed nobody made mistakes. It was the team that expected mistakes and built habits to catch them. That was the difference between confidence and arrogance. Confidence said, "I can handle this." Arrogance said, "I cannot be wrong." Emma had learned to respect the first and fear the second. The next year, she was invited to speak at another hospital. This time, she brought no photographs, no medals, no military records. She walked onto the stage carrying a small paper dolphin. The audience smiled. She held it up. "This is the most important award I've ever received." People laughed. Emma smiled. "It's not an award." She explained where it came from. Then she told them, "Don't wait for a dramatic moment to decide what kind of professional you want to be. Your character is built in ordinary moments. When a tired nurse tells you something. When a family member says, 'This isn't normal for my child.' When a student asks a question you don't know the answer to. When someone younger than you challenges your opinion. Those moments matter." She held up the dolphin again. Because sometimes the person you almost ignore is the person you most need to hear. The audience was silent. Emma placed the dolphin on the podium. Then she said, "Listen before you defend. Look before you assume. And when you don't know, say you don't know." She paused. "Those 3 habits can save more lives than pride ever will." The room erupted in applause. Emma stepped away from the microphone. She did not feel like a hero. She felt tired. She felt grateful. And she felt strangely peaceful. That was enough. If you're enjoying this story, take a moment to support it with a like, subscribe to the channel, and share it with someone who believes that listening can be just as brave as speaking. Sometimes the person who needs encouragement to speak is closer than we realize. Emma returned home after the conference. She placed the paper dolphin back on her desk. Then she received a message. It was from Sophie. "I got accepted." Emma smiled. She immediately called. "Accepted where?" "Medical school." Emma laughed. "You? Yes. You've wanted to become a doctor?" "Since I was little." Emma looked at the dolphin. "Why?" Sophie laughed. "Because of you." Emma's eyes filled with tears. "No. Yes. You don't owe me that." "I know. I want you to become whatever you want." "I know." There was a pause. Then Sophie said, "But I want to help people." Emma smiled. Then you're already starting. Sophie laughed. Grandpa says I have to remember to listen to nurses. Emma laughed. Your grandfather learned. He's very proud. I know. Sophie became quiet. Emma. Yes. Thank you. Emma closed her eyes. You're welcome. After the call ended, Emma sat alone for several minutes. She thought about the little girl she had first met. The frightened child. The pain. The fear. The uncertain future. Now that child was preparing to become a doctor. Emma smiled. Maybe the story had never really been about saving one life. Maybe it had been about what that life would eventually give back to the world. Sophie would carry the lesson. And perhaps one day, she would sit in another hospital room. A nurse might raise her hand. A doctor might dismiss something. And Sophie would remember. She would stop. She would listen. She would ask, "What did you notice?" And the cycle would continue. One person. Then another. Then another. That was how quiet courage survived. Not through monuments. Through habits. Through memories. Through people who refused to forget what mattered. Emma stood up. She walked to the window. The hospital lights were visible in the distance. People were still working. Nurses were still moving. Doctors were still making decisions. Families were still waiting. Patients were still hoping. The world had not become safer. But Emma had learned something important. You could not control everything. You could not prevent every tragedy. You could not always save everyone. But you could listen. You could look again. You could ask another question. And sometimes, that was enough to change everything. She looked back at the paper dolphin. It was still there. Small. Simple. Almost insignificant. But Emma knew better. The smallest things could matter. A word. A question. A glance. A hand raised in a crowded room. A nurse refusing to stay silent. A doctor willing to listen. A grandfather willing to trust someone he had never met. A little girl brave enough to say that something hurt. Those moments had come together. And a life had been saved. Emma smiled. Then she turned off the light. The next morning, another shift would begin. Another patient would arrive. Another nurse would have a question. Another doctor would have an answer. And somewhere between those two voices, there would be a chance to discover something nobody had seen yet. That was why Emma kept looking. That was why she kept listening. That was why she kept asking. Because the quietest person in the room was not necessarily the least important person. Sometimes they were simply the person nobody had listened to yet. And sometimes, when the entire room finally became quiet enough to hear them, everything changed. If the most important thing a person leaves behind is not a medal, a title, or even a famous story, but a lesson that quietly changes the way other people treat those who come after them? For Emma Carter, that lesson had never been about becoming famous. It had always been about paying attention when it mattered most. If you believe quiet courage deserves to be remembered, give this story a like, subscribe for more powerful stories, and share it with someone who understands that sometimes the smallest voice in the room carries the biggest truth. Years after the day that changed everything, Emma still remembered the sound of the hospital doors opening that morning. It had been an ordinary sound. People entering. People leaving. Shoes moving across polished floors. Phones ringing. Monitors beeping. Someone laughing near the cafeteria. Nothing about the morning had announced that it would become one of the most important days of her life. That was how important moments usually arrived. Quietly. Without warning. Emma had learned that lesson long before anyone called her a hero. She had learned it through loss. Through mistakes. Through long nights. Through moments when she had wished she could go back and change something that could never be changed. But now she understood something she had not understood when she was younger. The past could not be rewritten. But its lesson could be carried forward. That was what she had decided to do. She would carry the lesson. And she would pass it on. One nurse at a time. One doctor at a time. One patient at a time. The hospital had changed too. The old culture of silence had slowly begun to disappear. During morning rounds, nurses were now asked what they had noticed. Not what they thought the diagnosis was. Not what they believed the doctor should do. Just what they had seen. What had changed. What felt different. That simple question had become powerful. A patient sleeping more than usual. A child refusing food. A family member saying, "He's not acting like himself." A nurse noticing that a patient's breathing pattern had changed. Small observations. But small observations could become big warnings. The hospital created a new training program called the Second Look Initiative. Emma hated the name at first. "It sounds like we're selling eyeglasses," she joked. Dr. Rahman laughed. "Then give us a better name." "I don't know." "You started it." "No, the patients started it." Dr. Rahman smiled. "Then maybe that's exactly why it works." The program was simple. Every difficult case would include one question. What did we almost miss? Nobody was allowed to use the question as an excuse to blame someone. The purpose was learning. If the team had missed something, they studied why. If the team had recognized something early, they studied how. If a nurse had noticed something important, her observation was included in the case review. If a doctor had made the right call despite uncertainty, that reasoning was discussed too. The goal was not perfection. The goal was awareness. Emma became one of the main educators. She taught new nurses how to document observations clearly. She taught them not to write vague statements like, "Patient seems strange." Instead, she taught them to write what they actually saw. Patient normally answers questions immediately, but today pauses several seconds before responding. Patient who normally walks independently now holds the wall. Parent reports child is unusually sleepy. Patient's breathing changed after medication. Facts, not assumptions. Observations, not conclusions. She explained why. Your observation is valuable even when your diagnosis is wrong. One new nurse asked her, "But won't doctors ignore us if we don't know what we're talking about?" Emma smiled. "Sometimes." The nurse looked disappointed. Emma continued, "Your job isn't to control whether someone listens. Your job is to make sure you said what needed to be said." The room became quiet. Do not confuse being ignored with being wrong. That sentence became one of the most repeated lines in the program. It was printed on small cards. It appeared in training rooms. It was discussed during orientation. But Emma always added something else. Being heard doesn't mean you're right. That's why you keep checking. She wanted young nurses to avoid another danger. Overconfidence. She had seen what arrogance could do. She had also seen what insecurity could do. Both could hurt patients. A person who believed they were always right could miss something obvious. A person who believed they were never qualified enough might see the same thing and remain silent. The safest person was somewhere in between. Confident enough to speak. Humble enough to verify. Emma called it disciplined courage. That phrase became part of her teaching. Years earlier, she had thought courage meant running toward danger. Now she understood that courage had many forms. Sometimes it meant stepping into danger. Sometimes it meant admitting you were afraid. Sometimes it meant apologizing. Sometimes it meant saying, "I don't know." And sometimes it meant raising your hand in a room full of people who were more experienced than you. That kind of courage rarely received applause. But it could save lives. One afternoon, Emma was teaching a group of nursing students when a young woman named Leah raised her hand. "I have a question." "Go ahead." "What if the doctor gets angry?" Emma smiled. "Sometimes they will." "What if they embarrass you?" "They might." "What if they tell you you're wrong?" "They may be correct." The students laughed. Emma laughed too. "Then you learn." Leah frowned. "That sounds simple." "It isn't." Emma walked toward the front of the room. "The hardest part isn't speaking up. The hardest part is staying calm after you speak." She looked at the students. "You may be right. You may be wrong. You may be misunderstood. You may be criticized. But none of those things should stop you from caring about the patient." Leah nodded. Emma continued. "If you're wrong, apologize. If you're right, stay humble. If nobody listens, document what you saw. And if something changes, speak again." She paused. "Never let your ego decide how hard you fight." That sentence stayed with Leah. Emma would later learn that Leah became an excellent nurse. Years later, Leah would tell people that Emma had changed her career before she had even graduated. Emma never knew that at the time. She never expected to. That was another lesson. You rarely know which words will stay with someone. You might say something during a 5-minute conversation and forget it by dinner. The other person might remember it for 20 years. That is why kindness matters. That is why patience matters. That is why teachers matter. And that is why people who have suffered should be careful about what they teach from their pain. Emma could have become bitter. She could have used her past as proof that people could not be trusted. Instead, she used it to become someone others could trust. That was her greatest transformation. Not becoming fearless. Becoming useful despite fear. Not forgetting Caleb. Learning how to remember him without being destroyed by the memory. Sometimes she still visited the small memorial outside the hospital. She never brought flowers. She never knew what to say. She simply stood there. Caleb's name was not engraved there. It belonged to a different place. But the memorial reminded her of everyone who had served and never made it home. One evening, she stood there after a long shift. The sun was setting. The hospital behind her was glowing through the windows. She closed her eyes. "I kept the promise," she whispered. She did not know if anyone could hear her. Maybe nobody did. But she needed to say it. "I didn't stay silent." A breeze moved through the trees. Emma opened her eyes. Then she walked back toward the hospital. There was still work to do. Inside, a new patient had arrived. A young boy with difficulty breathing. The emergency department was crowded. Emma entered the room. A physician was already examining him. A nurse was checking his oxygen level. The boy's father was talking quickly. He was fine this morning. Emma watched. She listened. She noticed the boy's shoulders. They were moving harder than they should. She looked at the monitor. Then at his face. She asked one question. When did he stop speaking in full sentences? The father froze. He was talking normally an hour ago. Emma looked at the doctor. The doctor immediately understood. The boy needed urgent respiratory support. There was no argument. No dramática enfrentación. No shouting. Just recognition. The team moved. The boy stabilized. Later, the physician found Emma. "You saw it before I did." Emma shook her head. "We saw it together." He smiled. "That's not what I mean." "I know." She smiled back. "But that's what teamwork means." He nodded. "Second look." Second look. They laughed. That moment mattered to Emma. Because years earlier, someone might have dismissed her. Now the system had changed enough that the observation moved quickly from one person to another. That was the real victory. Not that Emma could recognize danger. It was that others had learned to recognize it too. A good teacher does not create followers. A good teacher creates people who can think without them. That was what Emma wanted. She did not want everyone to become like her. She wanted everyone to become more observant versions of themselves. The years continued. Sophie became a doctor. She specialized in pediatric medicine. On her first day as a resident, Emma was waiting outside the hospital. Sophie walked toward her wearing a new white coat. She looked nervous. Emma smiled. "How does it feel?" "Terrifying." "Good." Sophie laughed. "You always say that." "Because it's true." Sophie looked down at her coat. "I'm afraid I'll miss something." "You will." Sophie looked up. Emma continued before she could panic. "Everyone does. The goal isn't to never miss anything. The goal is to build a team that catches what one person misses." Sophie smiled. "I remember." "Good." They walked into the hospital together. For Emma, that moment felt almost impossible. The little girl with the scar was now walking beside her as a doctor. But Sophie did not forget. During her first month, she encountered a young patient whose symptoms did not fit the initial diagnosis. She remembered Emma's lesson. She listened to the nurse. She asked the parent questions. She ordered additional testing. The diagnosis changed. The child received treatment. Later that evening, Sophie called Emma. "You won't believe what happened." Emma smiled. "I probably will." Sophie told her the story. Then she said, "The nurse noticed it first." Emma became quiet. "What did you do?" I listened. Emma smiled. Then you did exactly what you were supposed to do. Sophie laughed. She was nervous to speak. What did you tell her? I told her you taught me something. What? That the person at the bedside may see something the person reading the chart cannot. Emma felt tears forming. That's all I ever wanted. What? For the lesson to keep moving. They talked for another few minutes. Then the call ended. Emma sat alone. She looked at the photograph on her desk. The old picture of Sophie. The old picture of the team. The small paper dolphin. Everything was still there. But Emma understood something now. The story was no longer hers. It belonged to everyone who had learned from it. That was how good lessons survived. They changed hands. They crossed generations. They moved from nurse to doctor, doctor to student, teacher to patient, parent to child. And sometimes they returned years later in a completely different form. A small question, a careful observation, a decision to stop and look again. That was the legacy Emma wanted. Not her name on a building, not a statue, not a medal, just a culture where people listened. One year, Coastal Valley Hospital received a national award for patient safety. The hospital administration wanted Emma to accept it. She refused at first. I don't want it. You don't have to make a speech. I still don't want it. Dr. Rahman smiled. You realize you're making this harder than accepting it. Emma laughed. Fine. She accepted. But when she stood on the stage, she did not talk about herself. She talked about the nurses, the technicians, the assistants, the doctors, the families, the patients. She said, a safe hospital is not a place where nobody makes mistakes. It is a place where people feel safe enough to speak before a mistake becomes a tragedy. The audience became silent. She continued, listen to the person who spends the most time with the patient. Listen to the family. Listen to the student. Listen to the person who is nervous. And when someone says, something doesn't feel right, don't laugh. Ask them what they noticed. That was the entire speech. Less than 10 minutes. But people talked about it for years. Not because Emma had delivered something brilliant. Because it was simple. Everyone understood it. Everyone could use it. And everyone had experienced the opposite. Being ignored. Being rushed. Being told that their concern was not important. The lesson was universal. Listen. Look again. Ask another question. That could change a workplace. It could change a family. It could change a life. After the ceremony, Emma walked outside. Sophie was waiting. You were good. Only good. Very good. Emma laughed. You're becoming difficult. I learned from you. They hugged. For a few seconds, neither said anything. Then Sophie asked, do you ever think about that day? Every year. Do you wish it had never happened? Emma thought carefully. I wish you had never been sick. But I don't wish the lesson away. Sophie nodded. Neither do I. They stood quietly. A few feet away, hospital workers were walking past. Nobody noticed them. And Emma liked that. She had never needed the world to notice. She had only wanted the right people to notice when it mattered. That evening, Emma returned to her apartment. She opened a small box in her closet. Inside were things she rarely looked at. Her old service photograph. A worn identification card. A folded letter. A few medals. A photograph of Caleb. She held the photograph for a long time. Then she smiled. You'd hate how sentimental I've become. She placed it back. For the first time, she did not feel like she was hiding from the past. She was simply carrying it. There was a difference. The past no longer controlled her. It had become part of the person she was. The soldier. The nurse. The teacher. The mentor. The friend. The woman who had learned that courage could be quiet. She closed the box. Then she placed it back in the closet. The next morning, she went to work. Just another morning. Just another hospital. Just another shift. But somewhere in the building, a new nurse was raising her hand. A doctor was listening. A patient was being watched carefully. And the lesson continued. Maybe that was the real ending. Not a dramatic rescue. Not an award. Not a news story. The real ending was that the people who had once been afraid to speak were beginning to speak. The people who had once been too proud to listen were learning to listen. And the people who had once believed that heroes had to be loud were finally understanding something different. Sometimes a hero is simply the person who notices. Sometimes courage is simply refusing to ignore what you see. Sometimes the most powerful sentence in a hospital is not a diagnosis. It is, something is different. And sometimes the most important response is, tell me what you noticed. Years later, Sophie would tell the story to her own students. She would tell them about the nurse who changed the way she understood medicine. She would explain that the nurse had once been trained in places where hesitation could cost a life. But she would also explain that the nurse's greatest lesson was not about speed. It was about humility. Never become so certain that you stop looking, Sophie would tell them. Never become so inexperienced that you believe you have nothing valuable to add. Her students would listen. Some would forget. Some would remember. And one or two would carry the lesson into their careers. That was enough. Because change does not always happen all at once. Sometimes it happens one person at a time. One conversation. One patient. One question. One second look. One raised hand. One person choosing to listen. And perhaps somewhere in the future, a young nurse would stand in another crowded hospital room. A senior doctor would speak confidently. The family would look frightened. The patient would be getting worse. And the nurse would notice something. Something small. Something everyone else had missed. She would feel nervous. Her heart would race. She might remember every time someone had told her that she was inexperienced. But then she would remember the lesson. She would raise her hand. Doctor, can I show you something? And someone would listen. That is how the story survives. Not because people remember every name. Not because they remember every detail. But because they remember what they were taught. Emma Carter never wanted to be remembered as the woman who saved a famous child's life. She wanted to be remembered as the woman who taught people to look twice. Because the truth was much bigger than one patient. There would always be another room. Another patient. Another difficult case. Another person who was afraid to speak. And the world would always need someone willing to notice what everyone else overlooked. Emma knew she could not be that person forever. But she did not have to be. She had already taught others. And they were teaching others. That was enough. So when people asked her what she considered the proudest moment of her career, she never mentioned the surgery. She never mentioned the admiral. She never mentioned the award. She never mentioned the photograph. She always gave the same answer. The day someone younger than me raised her hand and said, I think we should look again. Because that was when Emma knew the lesson had worked. The courage had moved on. It no longer belonged to her. It belonged to everyone. And perhaps that is the most beautiful thing about quiet heroes. They do not create copies of themselves. They create people brave enough to think, listen, question, and care. Emma's story began with a patient everyone thought they understood. It ended with an entire community learning that no patient should ever be reduced to a simple explanation. A fever could be more than a fever. A headache could be more than a headache. Fatigue could be more than tiredness. And a quiet voice could be more than nervousness. Sometimes the truth is hidden inside the detail nobody thinks is important. You just have to be willing to look. And look again. If this story stayed with you, leave a like, subscribe for more stories about courage, sacrifice, and people whose greatest strengths were hidden from the world. And share this story with someone who needs to remember that being quiet never means being powerless. Emma's hospital eventually became known for something unusual. People did not say it was the place with the best doctors. They did not say it was the place with the newest machines. They said, it is the place where people listen. And Emma thought that was the greatest compliment the hospital could ever receive. Because medicine would continue to change. Technology would improve. Machines would become faster. Tests would become more accurate. New treatments would appear. But one thing would never change. There would always be a human being standing beside another human being. And someone would have to notice. Someone would have to care. Someone would have to speak. And someone would have to listen. That was the lesson. That was the legacy. That was the quiet badge Emma carried for the rest of her life. Not on her uniform. Not around her neck, but in the way she looked at people. And in the way she taught others to look too. The hospital lights stayed on that night. The corridors remained busy. Another ambulance arrived. Another family walked through the emergency doors. Another nurse checked another patient. And somewhere behind those doors, another quiet hero was already paying attention. Maybe nobody knew their name. Maybe nobody would ever know their story. But if the moment came when it mattered, they would be ready. They would look again. They would ask one more question. And they would refuse to stay silent. Because sometimes the person everyone overlooks is exactly the person a life is waiting for. And sometimes the greatest badge of courage is the one nobody can see.